Hello and welcome to the Monday, August 9th, 2010 City Council Informational Meeting. We'll call the meeting to order. We'll start off with our City Council staff report from Deborah A. Owen, City Clerk, Chief of Council Operations.
Thank you, and good afternoon, Sioux Falls City Council. Most of the information I think we've discussed earlier via email in terms of we have the policy meetings next week in Pierre. There's the annual meeting for the Municipal League in October of this year, then also the National League of Cities. So just if you could follow up with those emails and respond back. That's all I have for today. Thank you.
Any questions of Deborah? All right, moving on to the Mayor's office. Mayor Huther is here.
Councilor Jameson, thank you very much. I, again, just wanted to express my thanks to the City Council. The people of Sioux Falls should know that your City Council was incredibly responsive and with all of last week's events. When we contacted them, they were there at City Council, some of them within 10 minutes, if not sooner, and many of them stayed throughout the duration of the entire event, and they offered help and support in so many different ways. So again, thank you, City Council, and also wanted to thank the city employees and, of course, the people of Sioux Falls as well for the way that they responded. There's just so many examples of how they went above and beyond in the spirit of keeping this city safe. We were very, very close to a public health emergency, and we averted it in most ways. Again, there are some people in our city that were impacted. We feel for them, and we'll certainly help them through this, but it could have been much, much worse. We are going to handle the immediate needs of the crisis, and we've made good progress so far. To the City Council, as you all know, the temporary bypass is done. And Councilor Entenman just asked me about the permanent fix. They're getting really close to finalizing the decision on what they're going to do with the permanent fix up there with the busted pipe up by the prison. I'll let Mark Cotter make that announcement when he's ready, but they're getting much closer to making that decision. Of course, we're also addressing the concerns of the residents that were impacted. We had about 120 with that first event during, it's like a week and a half ago, a rainstorm. And then, of course, we've got 30 others that were impacted by this recent one. Covell Lake is in much, much better shape. In fact, we're reopening it right now. So Covell Lake is in good shape. And the river continues to be monitored. We're not ready to contact the governor yet to have that reopened, but we believe that we're getting much, much closer, and we're hoping to have good news tomorrow. I think all of you are very interested, and I thought Councilor Jameson did an excellent job last week at the press conference. Councilor Jameson relayed, and I certainly will jump on his bandwagon with his permission. Councilor Jameson relayed that we also have to focus on the infrastructure of the city, not only on the infrastructure that you can see, but also the infrastructure that you can't see. And of course, that includes the sanitary sewer system that we've got. We will do that. Councilor Jameson talked about how the City Council will be there to provide the necessary funds to ensure that we've got good infrastructure for the city, and I will certainly support you and your efforts on that as well, and to make sure that the team within city government aggressively goes after that. And you'll hear more about that again in the days to come. One of the issues we have right now is that we still have so much water going through those pipes. One of the things that I can't wait to get at is to actually get cameras going through as many pipes as we can to find, again, those weak links within our system. And we can't do that right now because they're so full. But once they get down to a point where we can stick a camera through there, we'll continue to find those weak links and then improve those, and we'll keep the city informed. Last but not least, we want to continue to educate not only the City Council but also residents about what they can do to kind of help them for the next event. Insurance is certainly important. It's also, important not to discharge your sump pump water into our drains, as you know. We're going to do everything we can to identify these offenders these people that are actually continuing to do that and putting the people at Sioux Falls at risk when they do that. And then we'll also work with our code enforcement team to try to deal with those people as well. Again, I want to thank the people of Sioux Falls for their willingness to get involved in this crisis and to make a difference. And again, I want all of them to know that your city council definitely made a positive impact throughout the entire event as well.
Any questions for the mayor? If I could add a couple of comments, then, I was there at the Emergency Operations Center and saw the mayor and his staff operating, and they did a wonderful job. A lot of people working together to get the problem solved. We all should be proud of that work. A couple of the issues that came up that I felt or seemed to kind of recognize was the challenge the city has in communicating with people on the west side or even throughout the whole city. And I know that Mark Cotter is looking at a module that ties into the water billing system that would then allow the city to communicate directly with every water user in the city. And then that would be one way to notify them in a case like this that something's happened and please help the rest of us out. And that may come down to a point of funding someday, whether or not to add that module into their software program. Another idea, thought here is the ordinance that the city has on the books for the sump pump usage and how it's regulated. It's on an honor system right now, and citizens are encouraged not to have it flow right into their drain. I think maybe after Mark and his staff gets through the neighborhoods up there and kind of takes a look at that sewer system to see if there's just groundwater that's running in, if that's what the cause was, or if it's actually all these homes are just discharging right into their floor drains, maybe we need to reevaluate that ordinance on enforcement to give the city some teeth in managing that. Any other thoughts, questions, comments? Michelle Bach.
I would just say, as one of the counselors that was not there that night, I'm very thankful to city staff and to the mayor for letting people know as quickly as you did. My mom's house was in that danger zone right at 5:30 on that day, and we were able to get in and get things out of the way. Her house stayed dry and clean, and I am excited about that, but I'm just really thrilled that we were able to work together as quickly and easily as we did. I know that backstage it was huge, and you guys were stressed, but the way that it looked to us was smooth, and we got our stuff done, and I appreciate it.
Okay, good. Yes, Mayor.
Councilor Jameson, I tell you, I think we would actually appreciate this legislative body of city councilors if you want to add more teeth to that ordinance. I tell you, I would appreciate it. You know, I think that people just don't understand the impact that running a sump pump continuously into a drain. It's like someone sitting there flushing their toilet nonstop for 24 hours straight, and how that water goes into that sanitary system. And it's not just one. It's tens and tens of thousands of households that are doing that in our town. And so if you would want to tackle that, I'm in full support of that, and I truly thank you. And you know what? I think that the neighbors of Sioux Falls would appreciate that too. And I don't want to speak for everybody, but I think that people are tired of it.
Councilor Aguilar.
I would suggest then that go to committee, and probably in consultation with Councilmember Brown, Public Service Committee.
Okay, and Kenny is gone, but I'm sure we could probably assign that to Kenny. That's the problem with being not here, is you get assigned things. One other just thing I wanted to add, though, one of the key elements we need to know before we really get too carried away is if there's a lot of groundwater seeping into that system, we don't want to get too carried away or ahead of ourselves. If we come to find later there's a large amount of water just seeping through, then we can fix that, and we can know that it's not a problem of households who are actually just discharge it into their floor drains. But I think with the help of Public Works, we could probably figure that out down the road. But I'll certainly bring it up to Kenny and Councilor Erpenbach.
I just wanted to add to that the idea that, and the mayor has talked about it earlier this week, but we know for a fact that by looking at this water usage in Sioux Falls right now, if we compare a winter day when we're not watering lawns to a day like today when we had rain last night, we're using 4 million gallons of water more per day than we would on a winter day when we're not watering our lawns. We're dumping 4 million gallons of water per day back into the groundwater system, back into the storm sewer system. I would just ask that people push the off button on the sprinkler systems. I'm walking at 5 in the morning, and most of my neighborhood is watering at that point. And we're close to Pam Road, where those folks have been inundated. You know, it's not the most neighborly thing to do to keep running the sprinkler system when we've had almost 20 inches of rain. So I would beg people to please not water. Turn the sprinkler system off until we're dried out, because if it's seeping into the sewer system, it's creating more and more problems for our neighbors.
Yes, Councilor Rolfing.
Councilor Jameson, can you give a little bit more detail on the water system that would notify, or the system through the water meter that would notify people? Because that was the main thing that we were lacking, I think, that night when we were all around trying, and we couldn't believe the statistics that came through about 9 o'clock at night after all the efforts we made to try and notify people.
Just what I know is that everybody who buys water from the city, a resident, generally has to give a phone number tied to that address and that billing. And the software would log all those phone numbers, and then with just a click of a button, instantly send a message, a voice message to every user that says, there's been an emergency within the city. Please avoid using any water until further notice, or something like that.
Please turn on your TV or radio or
Something like
whatever.
that, right.
Yeah, okay. Good. That's what thank you.
Just another note on that, if you don't mind. Sitting over at the Emergency Operations Center, there was a lot of brainstorming, a lot of thinking about this whole situation. And another idea that came up was the possible use of the emergency sirens to notify residents of something that has occurred. You know, generally it's saved for tornadoes, and I can appreciate that. But here was a case where we didn't really have a solid way to communicate with the rest of the city to tell them something was going on and maybe they should tune in to news or something. I haven't discussed it with anybody, but it might seem a little nerve-wracking to the public. But, you know, we're sitting there, and the mayor and his staff was frantically trying to communicate, and there was limited options. The media had carried the ball for us in a big way, but we were just all thinking of different ways. But Councilor Rolfing.
I will tell you that I visited with a couple of people at my workplace about that, and in their hometowns, albeit a little smaller, but not, somewhat smaller, they have used that system for different signals and they are aware that, short beeps mean something completely different than the continuous siren. And so, yeah, it can work.
Okay, very good. All right, we'll move on to our rest of our committee reports. Audit Committee has no report. Fiscal Committee, Vernon?
We met last Wednesday, several topics, draft ordinance regarding budget transfers. We're finalizing that, and next month we'll review a final version of that, and we would invite Finance to be part of that discussion because we do have some questions on the effect of it. Contract agreement report format, we've moved that to the Audit Committee for them to really develop a way to sound the bell when a contract is not as it should be throughout the years that it is with the city. So we're moving that there. And examining compliance of audit contracts, the Audit Committee is also going to look at protocols developed in other cities there to develop that here. And then we were working on the Audit Committee membership ordinance, and that's when we had the sewer issues, and we will revisit that because we had to break. We didn't have quorum.
Any questions of Councilor Brown? All right, let's move on to land use. Bob is gone. Anybody else want to update us, anything that they've got?
We have no report. We haven't met recently. We do have a meeting in September, though, and our agenda is full with zoning issues.
Did we, what did we do with the RV issue? Did we,
The RV issue was moved from committee, since there were only two of us here that day, moved from committee to an informational session of the council. It needs to be scheduled at some point. We kind of last week talked about that for a minute in terms of our informational sessions are so full right now that we'd like to move it back just a little bit, if that's acceptable for the rest of the council. Otherwise, schedule it at any time you want. Deborah?
I was going to say, and I think you're saying this as well, but move to the informational for discussion purposes amongst, to see the will of the council. And then, of course, action would take place back in committee. So it would be...
Right, I
go
think
back
that
to
would be
committee for
correct.
action.
Yes, that we were just really kind of at a point where we wanted to kind of poll the council as much as anything. We're hearing lots of input on that topic, but it is not scheduled for a meeting at this point.
okay, very good. Any Public Services Committee, I see Kenny is gone, but who else is on that? Sue?
I don't think we really have a report right now.
Okay,
We postponed today's meeting to next month just because of budget hearings.
okay, good. Open discussion, any topics anybody like to discuss?
I just had one additional thing, and that was the National Night Out that was before the fun on Wednesday last week. We had a great time. I saw the mayor was out. Several of us were out. City Attorney Fikely was with me, and Russ Sorensen, and Officer Greg Schmidt, and my daughter were all in a car. We had a blast. I mean, I did. It was hot and muggy and buggy, but there was food everywhere, and people were excited, and it was a great evening. A good opportunity to meet folks, but also an opportunity to sort of celebrate that idea of neighborhood, that there really are advantages to knowing your neighbors and advantages to being outside in the summer and keeping track of what's going on in your neighborhood. So it was a great learning experience for me.
Any other topics, anything else? Mayor, you're back.
Councilor Jameson, I apologize. Just trying to tie into what Councilor Urbanbach talked about, and I apologize, Greg.
Sure.
We had this listening and learning session on Saturday, and we thought it was just going to be full of people that wanted to talk about sewer, and it was packed. It was the most packed session we've had. And Councilor Urbanbach, it was all about neighborhoods and being a good neighbor and revitalizing the neighborhood and strengthening the neighborhood. So I think you're hitting it right on the head, Councilor Urbanbach. There's this spirit to kind of taking their neighborhoods back and making them strong. So I think we're on to something. So good job.
Anything else? I'd like to maybe take a second at least and acknowledge our friend and colleague Dick Kelly, who is in the hospital with a recent surgery and on his way to recovery. We just want to wish him well and let him know we're thinking about him here in Sioux Falls. All right, seeing nothing else, move on to our presentations. And we'll start with our electronic funds transfer audit from Rich Osel, our lead internal auditor. Rich, welcome.
Thank you, Mayor and City Council. We talked a little bit about transferring money electronically, and on the page, I believe, 4 of your report, we kind of explain what ACH means, that automated clearinghouse, and the difference between that and the wire transfer. And there's also an analogy on page 5 about a shotgun shell and a rifle bullet, as the ACH is kind of like that shotgun shell where you have a lump sum coming out of our bank account going to First Premier Bank, and then it gets distributed to all our vendors' banks, whereas that wire transfer is kind of just one big payment that goes to another bank. The audit was focusing upon the ACH transfers because the wire transfers didn't. There's not a whole lot of those, and we thought the risk was in those ACH. That's something we do every week when we send our accounts payable payments out. And there's also some information there too On page 4, about the percentage of payments that are electronic and the advantages to electronic payment. It's a lot cheaper for the city. It's the cost is much less than printing a paper check and then having to mail that out because of all the costs you have with postage and check blanks and that sort of thing. Obviously, whether the payment is electronic or whether it's a paper check, you want to have very good controls in place. And for the most part, our opinion on the internal controls is that the controls are very good, and we had a few recommendations there. And I'd like to acknowledge that we had very good cooperation from our information technology folks and our finance staff, and good discussions there. And we had several recommendations, and you can see the management response on the very end of the report on page 14 and 15. We have Appendix 2, where we list the actual the recommendation over on the left, and then the response from management. And as far as the objectives, obviously the number one objective was to review the internal controls, and the number 2 was to see that the transactions were done accurately and timely. As far as the second objective, we did find that the transactions were accurate, that they were done timely. And as far as the internal controls, we had specific recommendations that start on page 7. One recommendation was that figuring out a way to keep the ACH file from being altered. There's a potential there before it's sent to the bank that you can open up that file and you can manipulate it. It's possible you could pull off a fraud. It would not be easy. We have a lot of controls in place as far as setting up vendors. There's detective controls that would catch that after the fact. But we just want to be clear that it is possible to open up that file, and as long as you don't change the total amount or the total number of transactions, it would be possible to alter that possibly and divert money. There's the management response on page 14. There's some issues with that make that a little difficult to correct that. And it's our position that there's sufficient controls to mitigate that risk. But we just want to make sure that our position was that, if possible, that you could lock down that file so you couldn't open that file up. The second recommendation was on page 8 about doing a reconciliation. There is a monthly reconciliation done, but it's just sort of the total amount, as long as that is the same. That's as far as the reconciliation goes. And there's some difficulties, which management pointed out on page 14, that with the financial software, that they can't get that information from the bank easily to do a detailed reconciliation. And then another recommendation was on page 9, and that was actually corrected during the course of the audit. We noticed that they weren't tracking the unused ACH numbers. Whenever they create an ACH batch, they assign a number to that batch. They weren't tracking those, but during the course of the audit, when we brought it to the attention of finance, they immediately instituted that. So that'd be a recommendation that was resolved. And then we had a few opportunities for improvement that were on page 10 and 11, and you can see the response from management, and they, for the most part, agree with that and are attempting to implement that as far as possible. As I said, the overall conclusion was the internal controls are good, and we just had a few recommendations for strengthening some of those controls, and the response from management was timely, and it was, as I said, we had very good discussions with IT folks and with finance staff. So if there's any questions, I'd be happy to answer those, or finance, or Director of Central Services, too, is here as well.
Any questions of Rich or finance at all? All right, another boring audit report.
Well,
Rich?
that's the way it goes.
All right.
Thank you.
Like those, actually. Okay, now we'll start our budget hearing process. I guess first on the list is Planning and Building Services. Mike, welcome.
Good afternoon, Mike Cooper, Planning and Building Services, along with Jeff Schmidt. Last Monday, we had gone through our overview of our budget proposal with the council, and I think in the spirit of running out of time, We were asked to come back and see if there was any follow-up questions that you might have. So that's why we are here this afternoon.
Does everybody remember? The idea was, we kind of rushed him out, so yeah, if there was any follow-up questions, I hate to even think that we don't have any.
That's okay,
should maybe
because
just
that's a compliment that we
come up
gave
with
such a
one.
great overview last time.
Well, we are missing a couple members. I appreciate you coming back.
And again, if there's anything that comes to mind, let me know, and we can get back to you.
All right, thank you.
We appreciate your support like everybody else does.
Okay, thank you. Next, we'll move on to the Health Department. Jill, welcome.
Jill Franken, Sioux Falls Health Department. Good afternoon. Well, we're here today to talk about the budget for the Health Department and, of course, have a presentation for all of you. Would like to just start by letting you know Amy Richardson is with me today. She had a large part to play in putting this budget together and assisting me. Amy, thank you. And I also just want to thank the managers and staff in general. As you'll see sprinkled throughout this presentation, it wouldn't have been possible if they wouldn't have been all bringing their information to this, what we're going to be providing today. And they all do a large part of the work in making sure that we stay fiscally responsible while doing good work. So just to begin, overview of our department. The Health Department is comprised of numerous complex areas of work that we do. We do sanitation and inspection, nuisance abatement, vector control. We have in-home daycare registration process, and public health preparedness and planning. We also have Falls Community Health, which, as you'll see from the budget standpoint, comprises the largest portion of our budget, and that's Falls Community Health, which includes our medical and dental clinics, our homeless health care services, school-based health care, just to name a few. There's many other smaller programs that are within that as well. In addition to those three that I mentioned, a couple that are most important are our mental health services that we provide, as well as our Ryan White Title III services, which are for our HIV and AIDS patients that we serve. Well, some of the things that we've accomplished in this last year include, it says 2010 accomplishments, but this is really a year's look at a whole year, and so that would be 2009 is the data that we have. Our public health response in this last week, you know very well that public health has a large part to play in what goes on in our city, and some of the things that we did last year that were very important for our community were our H1N1 response, and working with the state and our local, many local partners. We did seasonal flu vaccinations as well with that. One of the important points to remember with our H1N1 response is that the state then received the designation as the highest adult vaccination rate in the nation. The state of South Dakota received that. Well, I'd really like to think we had a large part to play in that becoming a reality for the state, given the population that sits right here in this community. Then we also have vector control, and we did over 12,000 sites, treated over 12,000 sites in the community last year. Again, to include with that as a fact that we feel good about is that we have a very low per capita West Nile cases in Minnehaha County. And while certainly someone could venture outside of, or in Sioux Falls, Minnehaha County, they could venture outside of Sioux Falls and certainly be exposed to West Nile, and it would still be part of Minnehaha County statistics. We think the work that we do certainly helps in keeping that down, not only for those that live in our community, for those that visit our community as well. A couple of other things that we did as it relates to code enforcement and our inspection work was revising our noise ordinance last year and looking for improvements that we could have in that. And we also had over 1,700 neighborhood nuisance cases that we worked with in that last year. So when you look at, I'm going to knock on wood right now, so far this year, because of the changes we made to our noise ordinance and the process, policy, and procedure that we put in place as well, we have not had one complaint from a permitted, someone that we permitted with a noise permit so far this year. And now that we're into August, I'm feeling really good about that, because certainly when I was complimenting on that at the end of July, I knew that we had a lot of events left, but we feel really good about that so far. We also have a 6% increase. That 1779 is a 6% increase in the number of nuisance cases that we manage. We also had 26 property cleanups in 2009. Now, certainly we don't want to have to go in and clean up any property in this community, but it is a public health issue, and when those cases come to the point where we have to go in and clean up that property, it's because we have assessed it and evaluated, and there is a public health issue there. We also, just to point out one last piece in there, is food establishment inspections were up 27% over the last 5 years, so it just gives you a little bit of a picture of where we're at with some of our work that we do. Now let's turn a little bit to Falls Community Health. You can see here our patient visits and number of patients that we serve are many, over 12,000 patients for almost 40,000 visits. We have homeless health care where we are serving over 1,300 people. And our school-based work is growing, which started just a couple years ago as a small little pilot project and is really getting some, we have now grown to having 2 sites that we're going to be having fully operational this fall. We've had a 13% increase in our total patients that we serve, 42% increase in the number of children, 39% increase in the homeless, and we have the highest number of refugees that we've served since we started the program in 2001. We also had a 17% increase in visits, and I think when we start talking about budget numbers, that'll be important to remember, because while we had a 17% increase in visits, we had only an 8.4% increase in our wages in that, in that particular division. So next, we'll talk about where we're at with revenues and bringing in money so that we can provide the services that we do in our areas. You can see that we, a large portion of the revenue that we bring in, 56% is charges for goods and services, or $3.8 million. 37% or $2.5 million is intergovernmental, with the remainder being the smaller percentages and contributions other, and then licenses and permits. So while we talk a lot about in front of this council about licenses and permits and fees and all those, it's really not a very big share of what we bring in for revenue to the city. I always like to remind everyone that money that we bring in intergovernmental and charges for goods and services, it brings to this community a health department that has access to resources that when we have public health events such as H1N1, things of that nature that we need to be really mobilizing our workforce for, we have a complement of people that are ready, willing, and able to drop their current workload and help the city in that way in the public health response. So one of the things that you see in the graphs when you look at 2008 to 2011 budget is increase in federal grant funds that we've received. We've also increased our partnering with the South Dakota Department of Health, which will continue to grow. And patient fees overall have increased due to increased activity in general, but also our school-based health centers and our dental programs have increased. One of the things that I want you to note is the green bar, which is 2009 original budget. That might show a little bit of a dip in our revenue, but by the end of the year, we're expecting that to be straight along, showing that an up curve, just like it did the red bar and the purple bar. It should be above, right along line there, because we are going to be doing a supplement for some grant funding that we received. The supplement to revenue will be $675,000, and expenses we're estimating to be just under $400,000. So the other point also that I just want to make when you talk about revenue that we bring in, there's a little line item in the revenue budget in 1804 that's from Metro Communications. Metro Communications budgets amount for the work that REMSA does, the medical director and the executive director, and that comes as a revenue to us to help with that fund, or for our expense for Julie Charbonneau and Dr. Luther as executive director and medical director. So they have to budget a little bit to pay for that because they're asked to share in what our budget in the health department is for the REMS activities. So they show that as an expense on there, and it comes in as a revenue to us to help offset those costs. So I just wanted to point that out. So intergovernmental revenues, we saw an 88% increase over the last 10 years. And again, some of those are from in the last 10 years. We have just been really fortunate to have some access to grant funding that has really helped us grow our services. Mental health, oral health, 3 grants just to oral health alone we've been successful in obtaining. Homeless care, refugee preventive health services, Ryan White, Title III for HIV/AIDS, our HIV prevention grant with the state, colorectal cancer state funding, which is leading to some additional prevention grants that are coming down the road with the State Department of Health, as well as our stimulus grants. And it was stimulus funding that helped support increased mental health services over this last year and will end the first quarter of 2011. So it's 2 full years. And also, it is provided some capital dollars to be able to finish off the school-based sites. Then we also had Community Health Center grant funding over this last 10 years with intergovernmental, which, let's see, we also had, those were intergovernmental revenues as a whole, and then the Community Health Center grant revenue, the next slide here with the 68% of intergovernmental, that is just Community Health Center separately. With that one, I just want to point out again that budget 2010 to 2011, that will go up by, with a supplement that we'll be adding to the grant, or to our budget of $460,000 in revenues. Okay, on to the next slide will be Community Health Center charges for services. Most often when we get grant funding in, we also budget in for third-party payers, Medicare, Medicaid, patients' responsibility. I always like to remind people we're not a free clinic, and so patients have a minimum fee that they're responsible for, and as well they get put on a sliding fee discount. And so whatever the grant portion isn't covering, then they are responsible for. And then we have insurance as well. We do have, it usually runs right around 10% or so of our patients have insurance as well. What often happens is they may come to us initially as uninsured, and then when they become insured, they like what they're getting with us and stay with us as a patient, and we encourage that as well. So charges, just a couple of points I want to make. Charges for our services were last increased January 1st of this year. The way we set our charges is we do it based on prevailing rates. We do a lot of research on what are some of the rates locally and regionally, and we make sure we're on board with not being too high or too low. We also look at our costs of providing service and set those accordingly, and they're approved by our governing board. Also, I just want to mention that our some other things that we are doing to help maximize our revenues. We really, since we're very service-oriented, we are, every time we see another patient, have another visit, have another activity level that goes on in our clinics, anywhere for our services, we then receive revenue. So we work very hard to be as efficient and effective as possible, and work very hard on what are ways that we can do that and increase our workflows. Our electronic medical record has had a significant impact. It was a significant investment. It was also a significant challenge in us transitioning to that electronic medical record, but we are starting to see some dividends, and I really give credit to our physician group and our staff that work with our providers. This was a huge learning curve, but we are starting to see some real gelling as it relates to seeing our patients, and that's one of the reasons we feel good about our charges for goods and services and how our revenues are going to line up at the end of the year. Let's see. Next, just a couple of points on this slide. Yes, our operating budget is $8.6 million, 5.2. Like I said, the lion's share of our budget is personnel. We're service-oriented. Our other operating is $3.4 million. We have a little tiny line item at the 2011 budget for capital, and that is for, I believe, a vehicle for our inspectors. Our health personnel is 9% of the total city budget. We also, I just want to point out that while that $5.2 million is indeed correct, we also have about another $1 million, roughly, that comes out of our professional services line items in the 2000 accounts. That is our services. It's our providers, our Center for Family Medicine agreement to provide the services that we do, our contract with Southeastern Behavioral Health to provide mental health services, some of our dental fill-in dentists do that, and as well as our nurse practitioners are in that category. So it's important to remember that an additional $1 million is really personnel, but it's just via contracts that we have with those folks. Okay, then make sure I'm staying on time here. Operating budget. Again, this slide is sort of a repeat. This is, but I just want to mention that one of the things that I talk about with professional services that I mentioned is how we've worked on our workflows, increasing our efficiencies, but we also changed some of our agreements with our folks that we contract with to make them productivity contracts, so they get paid per visit rather than perhaps by an FTE. So we're really paying them for value of work that they're producing, and that also is good for us because we can then directly align that to revenues that we're able to generate as well. Some other things that we've done is really try to be multi-use with all our equipment and supplies. An example of that would be through the stimulus funding. We were able to bring on some portable dental equipment that we thought would be very helpful in our school-based health center. Well, it's not only been extremely valuable there for our varnishes and cleanings and exams that we'll be doing. We did last spring and we'll be doing again this fall and onward. But it also helped us when we wanted to do some work this summer to get more people in for their cleanings in the clinic, in the main site clinic. So that equipment is being very well used in multiple locations as well. We'll look at taking it to some of our homeless sites that we do some intermittent services and other locations as we see. Again, I mentioned the improvements that we've made with our electronic medical record, which has also allowed us then to do more work on the front end than on the back end. So we're really getting, in our world, the change that we're trying to make in community health centers as well as just in primary care and in the clinic settings is do today's work today. Try and get as much work done today as you possibly can. And so some of the things that we were doing on the back end of the visit we're now able to do prospectively. And one of those examples is cross-training our transcriptionist. She doesn't do near as much transcription anymore because of our EMR, and now she's actually doing coding, and we're trying to work in prospective coding into that. And that's where I thank the physicians because they're having to learn as well how to be coders and do that kind of work with the visits. Then we also have our goals and our outcomes that we're trying to achieve. And you can see these here for our the environmental side. We are doing very well with our response to health code concerns and complaints within 48 hours. We also are just 1% off in our facility inspection scores being greater than 85. We felt like this last year was being greater than 85, if I said that wrong. This last year was a taxing year from the economic standpoint for restaurants, and it was noted in how they're having to really scale back on staff as much as possible, and maybe some of their things that they're ordering maybe don't purchase things quite as quickly as they might when they have like something that breaks down. It takes a little longer to get it fixed, some of those kinds of things. So that is what we've noted in those not being quite where we want them to be. And then code enforcement cases voluntarily resolved. Our goal is 90%. It was at 85, so we continue to look at ways that we can improve voluntary compliance with code enforcement. Then we also have our goals for our promoting and preventing disease. Number of children immunized by their second birthday. Our actual in 2009 was 55. We want that to be at least at 70%. From a clinical standpoint, these are not goals that we've just randomly set for ourselves, but are actually, benchmark standards that we are looking at achieving. We have been higher than this, but there are several of our populations that we work with that cause this to go up and down, but as our goal is to continue to work on processes that can achieve at least 70%. Hypertension is at 56, and we want that to be at 75%, and that's a national standard. And then homeless cases that we work with, we're slowly seeing that raise up. It was in the, I think, in the upper 50s in 2008, and now 74% in 2009, and we think that by 2011 will easily be at 97%. And lastly, access. Access is, what we're all about as well. In addition to preventing disease and illness, we're also all about access to services. And just to wrap up again, these are the services that we provide. We did have an increase of about 5% in our expenses in Falls Community Health in this last year, but I'd just like to leave you with a couple of facts, and that is that one of those reasons was expanding services to Terry, Redland, and Hawthorne Elementary, and we saw a 42% increase in children served in 2009. We also, it was in part because of increasing patients and visits at all our sites, 19% increase in visits, 13% increase in number of people served. The increase in dental care, our oral health grant, was also another reason for that increase. And it allowed us to see a 40% increase last year, and will continue to increase those services through the oral health grant. And then an increase in refugee patients. We saw a 30% increase, and a lot of that then comes with increased costs with interpreter services, which was another portion of our budget that increased. And then as well, that 39% increase in homeless patients that we served in this last year, and they can be very they require a lot of assistance and a lot of care, and so we feel good about that increase and providing that as well. And with that, I think I'm done.
Any questions for Jill? Councilor Rolfing.
Yes, Joe. On your line item, deferred compensation, can you explain what that is to me, please? Line item budget?
Sure. Do you want to point it out to me?
Yeah, on page 55 of the big budget. About under expenditures.
I know what it is, but I'm just...
I know what it is, too. I'm just wondering, are these people not covered under the pension plan?
I would want someone from HR to probably help explain that one. Or Jean.
Jill, I think the chief
Yes.
is trying to get your attention.
What's that?
Police chief is trying to get your attention.
It's the 457 match for our employee staff. Mid-management.
Councilor Brown?
Jill, a couple things. First of all, congratulations on the H1N1 vaccinations. I had a lot of citizens compliment what the city did last year. You did a great job on that. I have a question about, you talked about the 12,000 some sites with the mosquito control, vector control, but I see in the environmental health area, your budget is decreasing by 14%. Can you explain that difference for me, please?
Sure. A couple of opportunities that we have over this next year is to work closer with the State Department of Health. About $25,000 was reduced. We reduced out of our budget. We have been testing for West Nile presence in our mosquito pools at our lab here in town. at our city lab, and we are going to partner with the state. We'll batch those a little differently. We may not get quite the same data that we have in the past, but we also have now a history of data that we'll also draw on. So we're feeling good about the opportunity to be able to partner with them, and it's also a cost that we can reduce to our budget. So we're not feeling as if service or quality will be impacted in any way.
You'll still be able to maintain the current level of spraying and take care of the community in that way.
Correct.
And then you showed us the numbers, the increasing numbers you're seeing in patients. How do you project long-term where we're going to be? And you've said we've been very lucky in terms of grants, but do you foresee a point where the federal government won't be as generous with those, and how would that impact our budget long-term?
Actually, quite the opposite is going to happen over the next few years. The community health centers are going to be front and center, very much a part of and it's now called the Affordable Care Act. And so we are really looking, we should within the next few weeks, see some initial grant opportunities rolling out for community health centers. There's new access points that are going to be an opportunity, as well as expanding current services, adding additional programs to your existing services, and millions, if not billion dollars over the next fiscal years are going to be awarded in grants. And so we feel really good. We've got a good track record of demonstrating the need, and so we think we'll be adding. So looking at things like expanding our physician services, our primary care will be one of the things that we would look at. Mental health is just exploding as a need, and so that would be another area that we'd look at, as well as we just can't, a dental clinic, I wish I would have built it twice as big as it is, or we would have, but certainly we'll look for probably trying to expand in our dental in some way as well, using our out sites like our satellite sites like the school-based clinics, maybe doing more consistent dental work and remodeling those as we get funding for that.
And then under contracted services that are under your supervision, can you tell me what we get from the Parent Communication Network and Southeastern Behavioral Health?
Sure. Parent Communication Network, they provide the newsletter that goes out. I think it's monthly. It's the one that goes in all the middle school and high school, their newsletters that they put out monthly through the school district, and that's what covers the ability for them to do that, and that's that one. And then Southeastern Behavioral Health, it's the PATH program, and honestly I'd have to get more information on that one to you because I didn't bring it with me, but I know it funds the PATH program through It's some homeless like case management services that they provide, I believe, through that. So.
Thank you.
Yeah.
Councilor Erpenbach.
A couple questions about serving the homeless population. I'm amazed that the services you've provided for that population have gone up 39% over the last year. That's incredible. And I want to confirm that your goal is to get almost 100% of those folks. Is that right?
Well, it is. It was a really hard goal to write, outcome to write. And so technically, when we reach our goal that we wrote, we'll be serving the number of people that we said we have the ability to reach at any given time and serve. And so that's really where that's at. We wrote it for, I want to say, I know it's about 5,000 visits, right in there, give or take 100 or so. And then I'm trying to think of the number of people altogether. It's like 1,700, I think, is what we'd like to reach. Yep, 1,700. And so that's what we aimed it at, was based on what we wrote that. And that was doing a lot of needs assessment in the community as far as who would be, you look at who qualifies as a homeless individual in the description and the definition that we use as a community health center. And a lot of that is doubled up folks in the community that are in very tenuous circumstances right now. It might be a woman living with a boyfriend that is she's not maybe paying a share of the rent or even on the lease, and Those are the kinds of folks that maybe we are able to serve through that
And
grant.
you perhaps see some of them through the school clinics as well?
Yes.
Would that be right?
Yes.
Okay, so then, help me understand.
Sure.
There's a line item in, no, I won't be able to find the page number. The uncollected receivables on page 55 under expenditures, is that those folks, kind of, or is that just people not paying the bills that you've kind of set out for them, even though it's a small fee and all that kind of thing? Help me understand that.
Sure. We have a collections process just like any other clinic would. Ours maybe is just slightly more liberal. We try and give as much ability for people to make payments on their bill as possible. But then once we determine that we are writing that off to collections, that is when that becomes an uncollected receivable. And so, yes, they may be, but most of our homeless pay, if they don't have an address, or if it's less than $50 balance, we automatically write that off and do not send that to collections. That's actually written off to the grant. And so it isn't necessarily the homeless folks that we identify and quantify in our record as being homeless.
Councilor Brown.
Can I just, one more follow-up on that then? Can you quantify what we are spending for the homeless population? How much the city, and I realize most of it comes through, we're a pass-through for the grant, but how much are we spending for that population of about 1,700 people?
Our funding, and I didn't bring it with me, but I want to say it was, I'd have to get that to you, because it was anywhere from $250,000 to $300,000 that we received.
Okay.
But I'm going to get you that. I'll get you that.
That'll be great.
That
Thank
number.
you, Jill.
Jill, I want to follow up on the uncollectible receivables. Given that in 2009 the actuals were almost $750,000 and the budgeted is half of that, when we're seeing increased poverty, more homelessness, and increasing visitors to your clinic, how is that realistic?
Some of this might be, I think Tom could help me with this, but we work closely with finance to project what we're going to need, and some of it depends on, I'll start to explain this, and then Amy and Tom can descend on me if I'm doing a very poor job of it. But there was a time when we transitioned from software system to software system, and it caused us to have a little bit of a backlog at different times with what we were billing out because it was just the nature of what we were doing. Or we had policies and procedures in place that allowed a lot longer lag time to occur. We ended up then making that up when we kind of ramped up our policies and procedures, and we had then a huge chunk that we wrote off to collections in
2009, it looks like.
In 2009, correct. And so that's some of where that's at. That's going to be not the same from year to year. That's why I'm feeling really good about where we're at with our billing and collections process right now, because Amy's done a tremendous job, along with finance, to work through getting that process the turnaround time is a lot quicker, so then we end up having people pay on their outstanding bills a lot quicker. You all are in some level of business in one way or the other, so you understand that the quicker you can get a bill out, the better off you're going to get paid on it. And so some of that is what we've been able to do, and we feel good about the number, but certainly it's been higher in other years.
So year to date, you're comfortable with where you're at in the 2010, given the percentage of the year that's passed?
Correct.
And
that's another way, yes, thank you. That's another thing that we do is we look, quarter by quarter, and we're forecasting out where we're going to end up at year end, and we feel good then about how we've projected that 2011 number.
We must have done a good job. Tom and Amy were nodding the whole time you were talking. So. Thanks, Jill.
Like I say, it takes a team.
No other questions? Seeing none, I think we'll move on. Thanks, Jill.
Thank you.
Next, we have Community Development with Darren Smith. Community Development and Public Parking.
Yes, good afternoon. Darren Smith, Director of Community Development and Public Parking. As Jill mentioned at the beginning of her presentation, I have a few individuals with me as well, Dwight McElhaney and Randy Bartunik right in the front, and Matt Nelson, our public parking manager, right there. I think as you guys know, the budget process starts early in the year, I think in January even, and after only a few months into the year, much of what you see in this book is by and large put together. So Dwight and Randy in particular on the community development side were largely responsible for putting together what will be, what you see in the book and what I'll be presenting on. So I'm sure at some point I'll need help on some level. If I can just jump right in here. Ken, which of these buttons do I? To the right? I need to point at this thing? Okay. All right. This is pretty easy. So if I can just jump right in with 2009 results for our department, go right down the list and try to explain just very briefly some of these programs. 2009, we did 37 single-family home, renovated 37 single-family homes. This is our single-family home rehab program. Keep in mind, all of our programs are for those qualifying individuals who are 80% or below with median family income. Median family income levels vary depending on the size of the family, the number of family members, but all of our programs are only eligible for those at 80% of the median family income or below. So with this program, we have individuals who make application to have some kind of emergency-related repairs made to their homes. These are obviously for owner-occupied dwellings. They're typically paid back in two different ways. 2% loans over a number of years that we determine with the client, up to 10 years. The maximum amount for a project is $25,000. The average project is just under $11,000, so closer to $10,000 or $11,000 per project. Some of the loans, depending on income levels, they're deferred, so they're paid back not on a monthly or annual basis, but when they sell the property. That's when we get paid back for the loan, and those are 0% interest loans. I should also say that I think now that we're into our second day of hearings, our department is probably unique in comparison to a lot of the departments in that on the community development side, much of what we do is federally funded. And you'll see that that'll become clear as we move through some of the slides here. Public parking, of course, is an enterprise fund, so we're completely self-sufficient. We get no general fund dollars on that side. So again, these are by and large federally funded programs here with very little general fund dollars. Moving down here, 13 new homes constructed and sold. This is not only part of our neighborhood revitalization program where we're building new homes. We go in, find blighted properties, we acquire them, we bulldoze them, we make them ready for construction. In some cases, we'll find a home that doesn't need to be bulldozed but needs substantial rehab. But mostly it's bulldozing and building. So we were involved with 13 of those in 2009, 8 of which were our own, and 5 were done by Habitat for Humanity, which we also have supported financially historically. Continue moving down here. 5 mobile homes had emergency repairs completed. Again, very small program for emergency repairs. For mobile homes, these are up to $2,000. 19 homes modified for accessibility for persons with disabilities. Again, we work with some other organizations. We fund the Home Builders Association's Repair Affair program. This is part of that, and also something called an organization called Independent Living Choices. The Home Builders Association program is for owner-occupied dwellings, whereas Independent Living Choices is for rental properties. So we're covering both sides of things with those programs. 92 first-time homebuyers were assisted. Again, this is another federally funded program we have where we can help folks achieve home ownership by helping them with this program on the front end. These dollars are used for closing costs and down payment on a property. The traditional program will assist someone up to $6,000 per property, but if they are purchasing a home and qualifying, of course, in the core area of our city, we have defined boundaries for that. It's a very large core area of the city that we're trying to promote home ownership in. We'll actually double the benefit and assist homeowners up to $12,000. So if you think about the average value of a home in that area, maybe $100,000 to $120,000, and we're assisting up to $12,000. That's a pretty good incentive. With the Home Buyers Assistance Program, a little bit more of a complicated formula, but again, encouraging long-term home ownership. If you are in the home, if you receive assistance and you're in the home more than 5 years, it becomes a zero-interest loan, and we forgive 25% of that loan. So again, pretty good incentive to stay there long-term. If you're in there less than 5 years, when you sell it, you repay this loan. And if you sell it right away the first year, it's a 5% loan, and you repay 100% of it. And then each year you're in, it goes down. So if you're in 2 years, it becomes a 4% loan, 3 years, 3%, so forth and so on. But it's a good program. The reason you may see this number at 92, you may say, wow, that really spiked. You usually do about 50 of these, and you're looking at going back to 50 again next year. The reason this really spiked is because of the federal tax credit that was out there all of 2009 and just a few months this year. And I know our staff can testify to the fact that that made a huge difference with this program. It did encourage a lot of people to make that purchase. 44 furnaces replaced. I have a little asterisk next to that. That's because in 2009 we replaced 44 furnaces as part of a program, a one-time program with federal stimulus dollars. So this money was here, it's gone, we've completed the program. You very likely won't see this again next year. We did 44 in 2009, but when it's all said and done, because the program carried into this year, we will have ended up replacing 82 furnaces in town with this program. So it's been a very successful program, and 82 in about a 12 calendar month period. Tenant-based rental assistance and family self-sufficiency, I put a couple of these in here to give you an idea. A lot of times when you think of community development, or we talk about it, we talk about building or modifying stuff. Well, we do have other programs, and this would just be a couple examples. Tenant-based rental assistance is basically just what it states. It's rental assistance for qualifying individuals. And we're going to talk a little bit more as we move through with this program. Family self-sufficiency provides dollars to assist those who are in school, again, qualifying individuals who are in school with things like daycare expenses, gas money, those types of things. Okay, 2010. Just wanted to give you an idea here. These are the amount of federal dollars that we received, about just under $1.5 million in federal dollars. The reason I point that out is because in the book, and we're on page 97, as you go through the book, what will probably attract your attention is you see a lot of parentheses between 2011 and 2010. Parentheses are usually bad for departments. It means we're going the other way. We're going the wrong way. The reason you see that is, keep in mind, the 2010 budget is, we're right in the middle of this budget year, obviously. That was a projection. Purely speculation on what we would receive for dollars, especially with the federal dollars. And frankly, it's somewhat of a crapshoot each year. I don't think I can stand up here and tell you there's a science to determining what we'll get for federal dollars. We have a rough idea based on history and what we make application for and tell them we can do. Last year, we speculated, community development a year ago at this time speculated that they would receive a pretty good increase in federal dollars. Again, with everything going on at the federal level, with the stimulus, the economy, and so forth, we thought there would be a sizable increase, as much as $1 million in 1 year. Well, it didn't happen. So instead of getting $2.5 million, we ended up at closer to $1.5 million, and that's what we would anticipate for 2011 as well. So I wanted to point that out because I know that'll probably head off some of the questions later potentially. Although we did receive less dollars than what we anticipated, significantly less, by and large we are on target this year to achieve many of the goals that we set out to, that you were told our department would a year ago. However, I did want to, and these of course are on pages 99 and 100, I did want to point out a couple areas though that I can tell you right now I think will be very difficult for us to get to the goals that were established a year ago. In part, again, keep in mind the goals were established with these dollars in mind. The dollars didn't come in, and so some of these goals are going to be a little tougher combined with the economy. Just to give you a couple examples, number of vacant blighted properties acquired and cleared. Our 2010 goal was 8 properties, 8 blighted properties that we would acquire and clear for construction. Year to date, we've acquired 2. And I tell you right now, I don't see this number increasing significantly. We'll keep our eyes open for those properties that come along and make a lot of sense, where it's a good deal, but it's not in our best interest to go out and just acquire properties for the sake of a goal that's on paper. I think you would agree with that. Currently, we have 5 of our homes for sale, the homes that we build. They're spec homes in the Neighborhood Revitalization Program. We have 5 homes that are for sale. We have 6 properties that have already been acquired and cleared and ready for construction. We're sitting on those. So I've told our staff we're not going to build. I won't say that we won't acquire another property. Again, if a great deal comes along, we will. We have the dollars. But we're not going to build another home in that program until we've sold at least 1 or maybe more homes. I think that's what anybody in the home builder world would do. So we need to sell some homes. A couple other areas, again, related to that, number of homes constructed and sold to income-qualified individuals. The 2010 goal was 16. So far, year to date, and this number, again, includes those that Habitat for Humanity does, as well as our department. Year to date, we're at 6. Again, even if we sold all 5 that we've already constructed, that gets us to 11. And I don't see us beginning construction on another home and finishing and selling before the end of this year. So, again, the goal was at 16. The idea was more dollars would be there to do more. They weren't there. And so we're going to end up lower in this area. Also, a caveat here, the department did construct an 8-plex, which was the first for the department. It's at 505 South Duluth. Again, of course, for income-qualifying individuals. So that should probably be factored in here, too. Number of families who receive financial assistance with rent. That's a tenant-based rental assistance in some of those programs. 2010 goal was 40. Year to date, we're at 26. Staff feels we'll probably end up around 30. The reason for this primarily is because with the economy what it is, people are not leaving assistance programs of any kind. We have money in this budget in this area to help 20 individuals at any one time. But the reason you'd set a goal at 30 or 40 is because, of course, some are on the program, then they're off the program, and you help a new family and so forth. But I do not see us getting to 40 in this area. Just, again, people are not leaving assistance programs that they're on. They're staying on for the whole time right now, and I don't expect that to change. Then lastly, the number of public hearings held. Goal was set at 6. Year to date, we're at 3. My best guess is we'll end up around 4. I think the thought process here was with federal dollars comes a requirement for public hearings. Well, again, some of those federal dollars, they didn't come in as we anticipated, and so then the public hearings would be impacted accordingly as well. Other than that, I think we're on target in about six other areas. I just made a note that home sales are slow. Again, I mentioned that. That's not unique to us. That's where the economy is at in general. Okay, moving on here. Community development funding. This lays out where we get our dollars. The 41% in grants, that's basically the accounting term for federal dollars. Those are our federal dollars. This is a little misleading. You may say, hey, just a few moments ago you told us you were largely federally funded, but a fourth is general fund here. Those general fund dollars are largely pass-through dollars that go to for economic development purposes. The Sioux Falls Development Foundation, Forward Sioux Falls, and Downtown Sioux Falls. So a little over $700,000 of the $1.2 million in general fund dollars we don't get our hands on. They pass right through us to those other organizations that we partner with for economic development purposes. Now, of the $500,000 that's left, give or take, most of that goes to over $400,000 goes to support staff. and we use federal dollars to support staff as well and pay for salaries. And then about $120,000 to $150,000 of general fund dollars actually goes to programming, and that goes into largely into our, well, exclusively into our neighborhood revitalization program, again, where we're acquiring property, bulldozing, building new, or substantial rehab. So just want to make that clear. So a little over 100, maybe 150,000 out of the $5 million budget really goes from the general fund to some of our program areas. The revolving construction, this is our revolving fund for neighborhood revitalization. This is just dollars, it's money in, money out. We spend money to build a home, and then when the home sells, we get that money back, and that's a large part of what we do. The 9% in loan payments, this would be for some of the programs I talked about earlier, the single-family rehab. Those are loans that come back to us over time. Some are paid monthly, some are paid in lump sum when the home is sold. And then our home buyers assistance program, same thing, paid back when the property is sold. So again, we're supporting ourselves in that respect, but those are programs started with federal dollars. So when they come back in, they still have those federal strings attached to them even years later. The 2% miscellaneous, this is basically interest earned on pooled cash. Much of that is there with our revolving fund that we've established. 2011 community development operating budget, again, much of what I just mentioned, less than a fifth of our total budget goes to personnel. So good bang for the buck, I think. And then you can see here how things break down going forward. Again, if you look below at the chart, and this chart is actually repeated on the next page, but if you look at the chart, you might say, oh, geez, again, a decline from 2010, but yet an increase over 2009. Well, again, it really wasn't a decrease from 2010. We're in 2010. We didn't get those federal dollars that the department thought they would. So we're really not seeing a decline. In fact, a slight increase from 2009. And the reason for that is because the transfer of responsibilities that the mayor announced a few weeks ago from the planning department to community development with the two FTEs, and for neighborhood redevelopment, Pettigrew Heights, Whittier, some of those, as well as the economic development subsidies I talked about, the over $700,000. That's where the increase came in. Next slide here, operating budget, personnel and other operating. Again, same chart below, but I did just want to touch on something I just mentioned. The reason for the transfer to the neighborhood redevelopment will be focused more in those areas than we have been historically as a department because of the transfer responsibilities and the FTEs and some program dollars that come with it. Neighborhood associations, this is something new. In terms of seeing more neighborhood associations throughout the community. And Councilmember Erpenbach just spoke a few moments ago about neighborhood night out with crime watch groups. What we want to do is start with those groups and ask them, hey, if you like what you're doing, together as a group, as a neighborhood association, if you will, but focus exclusively on crime, would you like to expand the focus of that group? And we could come in once a year and talk to you about all kinds of city issues. So they can still have the crime watch aspect. That would be, an important focus. But in addition to that, we could go out and meet with them once or twice a year, whatever their request is, to talk about other issues in the neighborhood. So I think that'll be good. Get more neighborhoods involved in what's going on in the community. And then economic development, again, that's going to be a big part of what we do, partnering with the organizations I mentioned earlier, and everything we'll be doing downtown. 2011 service levels, just a couple slides left here. Performance targets remain consistent. Basically what you'll see in the book is 2011 targets are very consistent with 2010. I think that's relatively accurate. It's going to depend, of course, on what we get for federal dollars. To give you an idea of how difficult it is to budget for this department in particular, we're speculating right now what we'll get for federal dollars, but we won't actually find out from the federal government what we get until probably March of next year. And then we won't actually get those dollars until May. So it's just the federal government and their incredible efficiency. It's just how it works. So it makes it a little tough, but we think we can meet a lot of the targets in here. Second bullet there, aggressively pursue additional grant funding. This is, again, something that is going to be new for us. We're not going to continue going forward just hoping and praying for federal dollars and what we get from the city and so forth. We're going to go look for other dollars, whether those are federal dollars and other programs like CDC programs or other federal entities or private grant dollars. We just don't want to be restricted going forward, handcuffed, if you will, like we have been historically. So we've got staff, including Dwight here again, who's going to take the lead in that effort. I'll work very closely with them. We have another staff who's going to help write those grant applications, because that's important too. And then economic downtown development activities. Again, I've mentioned this a couple times, but with the new staff, we'll be very focused on what we're doing downtown and with our other, all the downtown incentives, other things, tax increment financing, federal stimulus dollars that are available to be used downtown as well as throughout the community, tax abatement programs and so forth. And, of course, parking's part of that as well. Okay, looking ahead, last slide. Just want to give you an idea going forward, some of the things we'll be focused on. Quality, affordable housing for those below 40% of median family income. This is right out of the housing study that we just heard about a couple weeks ago. This was the number one thing, really. The top priority said that we're doing a pretty good job in the community, especially working with the private sector to provide affordable housing for those at 40% or above. And then I think at the lowest end of the spectrum, those probably below 20% of the median family income, we're assisting in that area. There's faith-based organizations that are assisting, but there's those at the 20 to 40% levels that are really kind of caught in between. The tax credit housing projects, some of the other federally subsidized projects really aren't going below 40% because they can't cash flow those projects without some kind of rental assistance. So that's where we're really going to target. We've already begun discussions with some of those folks in the community who do a really good job in that area, and they're very excited to work with us, and so we're gonna be able to make something work here. Comprehensive case management. That's also something we're going to focus on going forward that we really haven't much historically, or as much as we should. And we'll be talking, when we meet in September with the Public Services Committee, and then going forward with the full council, we'll be talking about some new program areas that we'll be focused on. And this would be one of them, a program where we could use dollars to help those at the 20, 30, 35% levels. But there's going to be case management involved in that. I think most would agree that if you continue to just provide funding, to provide shelter for someone, it's the old adage of give someone fish or teach them how to fish, and that's the direction that we would like to go. We think there's a lot of room here where we can really help people in a lot more ways than what we're doing now. So I'm pretty excited about that, and we'll be coming back and talking more about that. Neighborhood revitalization changes. I mentioned we're sitting on 5 homes right now, 6 properties. So I've talked to a lot of folks in the affordable housing community and said, what do you think? What's it look like out there? What do you think of our program? And basically what I was told pretty consistently is we need to make our homes more marketable. Currently we do not put garages on our homes, dishwashers, things of that nature that maybe years and years ago were considered a luxury, not so much anymore. And we're selling our homes, keep in mind, up around the $120,000 range. That was the other thing. They felt our homes had gotten a little high. So we're going to bring those down. Now, I know a logical question would be, well, geez, if you're going to add those things, does that mean the cost is going up? And the hope is that it will not, because the other thing we've done is we are building homes that are as large as 1,200 and 1,300 square feet on the main floor, which is pretty good size. So we want to get those back closer to about 1,000 or 1,050 perhaps on the main level. And what we save in square footage there, we can put into things like garages and dishwasher. Also, the pre-sale approach, and then tying in with establishing a housing continuum model. If I can, just briefly, goes back to what I talked about earlier. What I'd like to see us do is use the dollars we have now in a little different way. We would provide rental assistance for individuals, just like we do now, but it would be more targeted to the income levels I mentioned earlier. There would be intense case management. If you can think of the Heartland House program, it would be like that type of monthly classes. Good stuff. It would be required to receive the rental assistance, be a 2-year program. And then as we get close to the end of that 2-year program, let's say at the 18 or 21-month mark, we could then approach these soon-to-be graduates, so to speak, of our program and ask them if home ownership is in their near future. And hopefully it is, and if it is, then we can talk to them about our neighborhood revitalization program and build them a house if they qualify, or talk to Sioux Empire Housing if they want to be on the edge of town, because our homes are in the core of the city. So again, what this does gets us to a pre-sale approach. Right now we're building spec homes, as I mentioned. If we would do this, we wouldn't be sitting on homes. We'd build them as we have qualified individuals, but still accomplishing everything. And then just finally, again, a couple things that came out of the housing study. Support quality low-income elderly housing. This is also something came out of the housing study. We've talked to some folks in town who do this, and there's a good chance we can work with them and accomplish something in this area. And then finally, improving minority home ownership. Also something out of the housing study, and we'll be working with the Multicultural Center and Lutheran Social Services and those types of organizations to see, number one, make sure they know about our programs, our home buyer assistance program and some of our other programs, and how we may be able to modify some of our programs to assist in those areas if that's appropriate. And the last thing I would say is you see the word quality 2 or 3 times throughout. That's not unintentional. We really want to focus going forward on making sure our dollars are assisting people with quality housing, and not just putting them anywhere in town, but quality housing. That's very important to us. With that, I will conclude and take questions.
Councilor Aguilar.
Darren, I just want to make sure that I understand this. On page 98, under expenditures, the increase in personnel from full-time, that has to do with mainly the movement of the 2 employees over from planning.
Correct.
Okay, and then down under professional services, that also got moved from a different area? Or has that always been expended through your department?
I believe professional services is one that we've always had.
You're talking about the 3 underneath that, right?
Yeah, the
Sue?
Sioux Falls Development Foundation.
Oh, I'm sorry. I thought
downtown
you were
Sioux
talking
Falls.
about that line item, the professional services line item. Okay.
Okay, I'm
Below
sorry.
the Development Foundation, downtown Sioux Falls, and Fort Sioux Falls. Yes, those were moved from planning.
So actually, that it would show for the 2008, 2009 budgets, it would show under those, the planning's budget.
Well, it would.
You just brought them forward.
And if I can, because that's a question that I had too, and so I had to call Tom and these folks, and basically that's why you can look at previous years, 2009, 2008, and the general fund contribution line item on page 97, and say, wow, it's relatively consistent. I thought you said you brought in $700,000. Well, because they went back and changed it historically, so those dollars didn't actually come into our department in 08 and 09. They went into planning, but this is the way they do it.
But they're not actually there for 2010 either, are they?
Well,
Or were they moved?
No, they're not.
They
But
won't be
again,
moved,
it's an
no.
accounting thing
Okay.
where they go back and make it look like it was put in. Yeah, I know. This is why I'm not an accountant, but trust me, it makes sense.
Trust me.
But does that change the percentages as far as the increase in the amount of dollars? I mean, the overall picture, you can't really compare apples to oranges from...
That's
It's an
why.
accounting.
It's
an
an
accounting
thing. Okay.
It is. As a non-accountant, I look at it the same way you did, which is why I called them and said, hey, we plugged these numbers back into previous years. And is that right? And they said, yes, it is. But again, that's how.
Darren.
Be consistent if we can, so that you can look across an academic. Tom Huber with Finance. If we can, we try to be consistent where we can lift those dollars from from year to year and bring them forward, so that when you're looking at economic development line, it doesn't throw you saying, well, is that a new program or what is that? No, it existed, it just existed in a different place. And when the budgets provide for that, and this is probably more common in the private sector even, is that, you know, their systems allow you to just change it, it goes back and changes the whole history. Ours, we have to manually pick up and move. So when we can, we do that to keep it consistent. It throws the departments off from year to year a little bit, but at least it keeps some of those lines fairly consistent. But like for the staffing, we can't do that because there's no way to lift that out easily.
Does it have to do with our accounting software, too?
Our accounting software doesn't allow us to do pro formas as easily as you'd be able to with a more updated system.
Okay, thank you.
Councilor Brown?
Actually, I'm on that same area, Darren, with the downtown Sioux Falls.
Yes.
Saw a dramatic increase in
Yes.
2011 budget. Can you explain that for me,
Yes, I can, and it may require Tom coming back up. This is another accounting deal. As I think you're all aware, in fact, there's an item on the agenda tonight for the Downtown Business Improvement District, the assessment. Those dollars eventually make their way to the city, and we just turn around and give them to downtown Sioux Falls. That's just how it works procedurally. The reason this jumps is because historically, accounting has not treated that as revenue. The bid assessment dollars that come in were not treated as revenue, but I believe in audit encourage them to do that. And so now you're seeing this increase when the reality is it's
Flat.
not. It's an accounting thing.
Okay. And then, just to clarify, I think you answered this, but below that, the other current loans and grants
Yes.
dropping, is that just in anticipation of less federal dollars?
Yes. Basically, that line item is everything, almost everything we do. It's all of our programs right in there. And so when you anticipate more federal dollars, you anticipate spending more. It's kind of a money in, money out, and it impacts everything. So, yeah, there's not that dramatic decrease.
And then a couple questions on the neighborhood revitalization. Those 5
Yes.
homes that are for sale, how long have they been on the market? Do you know?
Yes. One is not quite finished yet, so that will probably be closer to October. That will be our 5th. That will be on the market. One was just recently finished. The other 3, I believe, have been on the market since this spring.
Okay.
So, not as bad as some people out there who are trying to sell their home will sit on it 6 months or even a year. We're not at that point yet. But still, it's just it's something we want to really monitor and pay attention to.
Is it, and I would never want the city to get in a situation of being a landlord, but are there opportunities considering how many people, Jill and I were just at Homeless Advisory Board meeting today, for those families making $20,000 and less and trying to struggle, is there any opportunity that for even short term that we could consider leasing or through interlakes with case
Yep.
management, using those homes instead of leaving them vacant through the winter?
That's a great question. I think we would consider all of those things. So we're utilizing these structures, and if we have those homes and somebody needs a home, we want to do that. And interlakes would be one that I would really look at going to, for the simple fact, when we talked earlier about getting that case management component involved. I drove by one of our neighborhood revitalization homes that we sold, I think, a year or two ago, and most of the windows are knocked out of it. And so you look at that and you say, how do we make sure we get people in these homes who deserve them, will take care of them, because we have limited resources. That's the reality. And I think you've probably all heard at one time or another, there's over 3,000 people on the waiting list for rental assistance with Sioux Falls Housing. So, these are precious commodities. We want to make sure the people who get them take care of them. And so my hope is that going through a program with case management and a Heartland House type program, when they come out and they purchase that home, they're going to take care of it and value it like we do our own homes.
And then my last question is, you have a lot of outcome-based indicators here, and I know you've only been on the job for a month, but I think it's important for us to also see the indicators for economic development in downtown, so we know what your goals will be in improving those areas.
Thank you. And if you would look on page 95, if you would, under Planning and Building Services, It's a great question. In fact, it's one I wrote down, that how do we measure what we do in economic development and downtown development? And I thought, I might get that question. So I started looking, on the planning and building side. In fact, I talked to Mike Cooper earlier today and about this. So many of the things you see in here, not all of them, but I think many of the things you see in here will probably be in our area next year. But I'm hoping there may be even additional ways we can track, maybe the dollar amount of as downtown increases in those projects we were involved with in helping in some capacity, and what we're able to do citywide. If there's a way to somehow quantify that or measure it and show you that, so.
Some of it might even be just through land value in the downtown.
Yes.
I think that's increased dramatically over the last 10 years.
Absolutely. Yeah. No, it's a great question.
Thanks, Darren.
Councilor Rolfe?
Yes, Darren, you mentioned at the beginning of your presentation that we just got done building a eightplex.
Yes.
Were we in conjunction with somebody building that, and are we going to be the landlord, or who's?
Yeah, we did that in partnership with Sioux Falls Housing Corporation. It's 8 units. I think they're 300 to 500 square feet each. I hope I'm not missing the mark on that. One is dedicated for handicap accessibility. So a little different approach, again, with the kind of the multi-family approach in addition to the single family that historically we've done.
Okay. So they'll be running it?
That one's going to be open, yes. And that one, I believe, is supposed to be ready to be lived in Labor Day. And I know one of the things we'll talk about here, I talked to Jim Schmidt with Sioux Empire Housing. He wants to do a housing tour for you folks later this month. He'll be reaching out to you about that, and we'll partner with them on that, and I want to get you guys out to see that one in particular and a couple others.
And Councilor Litz?
Thank you, Mr. Chair. Darren, on the community development funding, the 23% revolving construction, did I hear you say that when the money, you do the expenditure, but when you recapture that money from house payments or whatever it may be, are you still subject to the same federal restrictions that you did before when you first got the money?
We are with the loan repayments we get, that 9 to 10% area. With the revolving dollars, this is another one that's a little more complicated. There were some dollars that we received years ago. Dwight, I'm just going to have these guys, because it's a little more complicated.
Very good.
Dwight McElhaney, Community Development Manager. The revolving fund dollars that we're using for construction no longer have any federal ties to them. Most of the money came from the repayment of the UDAG loan, which was on the Holiday Inn City Center, that we got paid back over time, and then a fairly large lump sum at the end of that program.
Good, thank you, Dwight.
Any other questions for Darren? Seeing none. Are you going to hand it over, or are you going?
I'm going to have Matt do the parking, and I'll be here, but yeah, Matt's going to do that.
My name is Matt Nelson. I'm the parking manager for the City of Sioux Falls, and most of what we deal with for parking, as soon as I can get this to work, which button, is downtown parking. You can see where we fall in the enterprise circle here. We're only 3% of the pie, where most of the other enterprise funds have a much larger budget than we do. Where we're an important function for the city is we provide parking in the downtown area. It helps attract businesses to downtown, and it's also helping with the development and residential units going into the downtown area. We provide mixed-use parking. So our parking is free after 5 p.m. and on the weekend. So when you talk about the public aspect of it, it is used by the public for free. And we charge for lease parking, mostly from businesses that use it during the day, Monday to Friday, 8 to 5. This is a summary of what we provide. We've got nearly 3,000 parking spots that are off-street parking, only about 1,000 that are on-street. So there's really no way with our occupancy rates for all those people to park on the street if they wanted. Without us, there wouldn't be the businesses downtown for the parking that's provided. We have 5 parking ramps and 15 lots. I think it's been said several times, we are an enterprise fund. We are self-supporting, so we do not receive general tax dollars to support our operations. We get that through fines and fees that we collect. One of our major accomplishments that we've done this year is we've reduced our workers' compensation claims by 17%, or actually our dollars paid out. Part of that is through the T3, or the Segway that you see running around downtown, which I'm sure some of you have been asked about. And our rates are very low. If you compare us to the regional area rates, starting at $32 per month and 60 cents per hour, it's a fraction of what you'd pay in some of the comparable cities in our area. Rates, too, when you talk about parking tickets, our parking tickets starting at $5 are also extremely low, and I think you'd be hard-pressed to find anybody that has a parking ticket at that rate. Where our budget's made up of, most of our budget goes to personnel. A little over 50% of it is actually in salaries. We employ 15 employees. 6 of them are enforcement officers that work in the downtown area, and 2 of those actually drive throughout the city and enforce parking. The rest of them are for the maintenance and daily operations of the parking ramps and lots. $0.8 million is just for our general operating budget, which includes repairs, cleaning and maintenance that we do day-to-day operations. And then capital, we have a small amount of capital improvements we're looking at for next year. The biggest one you'll see is the ramp gate equipment, which is approximately $90,000. And that is to upgrade existing access systems that we have for the ramp, which may actually increase some of our efficiency in the long run, too. What do we provide for parking? Our lease rates aren't where we want them right now. We're at 74%. Our target is 82%. And you can see historically where they've been. With the economy booming, we kind of ramped up. We were nearly 100% leased in 06, and we saw a slight decline in 07 and 08, and we saw a major tenant leave downtown in 2009, which was about 17-18% of our leased parkers left with that. Pretty simple and straightforward. If you have any questions on the parking budget.
Any questions for Matt? Councilor Brown.
Just one, in terms of the decrease in number of rentals down there, what does that do in terms of the repair and maintenance, which I believe we've always struggled to stay ahead of?
Well, it's we're still doing okay. We've got some targets set for how much we want to bring in. We're still operating in the green. We've got a good structural maintenance account set aside. I think financially we are very sound. Per professional recommendations, we've got approximately $800,000 put aside right now for emergency repairs. With the rates that we're at right now, I don't see us where we could fund maybe an expansion without a major tenant coming downtown, but we can definitely maintain what we have.
Councilor Anderson.
Matt, what's our schedule with that 9th Street parking ramp? I know with the development of the Schoenemann's property, doesn't that have to be removed, and what's our schedule for that?
If that development and when it happens, we don't have an exact timeline, but we're actively working to pursue taking that ramp down and relocating people. It's kind of now we're working with the developers, and we're kind of on their timeline. We're working as fast as we can, but I don't have an exact date at this point. I mean, I hate to say it, we've been in that same boat for the last 5 years. It's going to come down in 2 years. It's going to come down in 2 years. Hopefully now I think we're at the point where hopefully it happens in the next year, but I don't have an exact date.
And then what are we expending on repairs on that parking ramp yearly right now? Because I know we're keeping it, holding it together right now.
It's in line with our other parking ramps. It's probably actually a little higher. We're $400 roughly per year per spot in maintenance and repairs, which is just kind of an overall budget picture. Last year we had to drop $50,000 in emergency repairs, which include major patching on the top level of the ramp. There's anywhere from $500,000 to $1 million in major repairs that are due on that ramp. And if this deal does not go through or we cannot do anything with that ramp, we'll either have to make those repairs or it comes down. And those are our options.
Thank you.
Okay, I guess.
Can I just add a couple things? I think it's important for you guys to know about. One is, from a policy perspective, we're going to work on putting a written formal policy in place for inspecting our ramps. That's not something we currently have, and that may be something we come to the City Council with. We have to figure out what that process is. But I think it's important if we think about what happened in Minnesota a few years ago with the bridge and making sure that we're not only taking care of the ramps we're supposed to be and having them inspected, but that we have a written policy in place for the safety of those who use a parking system and also in terms of the city's liability. So that's something. The other thing we'll be looking at next year is experimenting potentially with a small number of meters that accept debit cards and credit cards. So I think that's something from a convenience perspective. Also understanding there may be an adverse impact to the more someone uses a debit card, less chance they have for running out of coins in the meter, and then we don't get those yellow tickets that we like. So it's a little bit of a trade-off, but we do think there's a convenience issue there that many would potentially welcome. So we'll pilot something there and see how it goes. Thank you.
Okay, we have a request to maybe take a short little break for like 4 minutes. If we could reconvene here at 4:50, so that's just about 5 minutes from now. Short recess. Okay, we'll start our meeting again with the presentation from Chief Barthel. Barthel with the police, I guess.
Good afternoon. In typical law enforcement fashion, I don't go anywhere without backup, so I've also brought along our command staff who played a key role in helping put together our budget. I particularly would like to recognize Assistant Chief Patty Lyon and Kay Faber, our administrative assistant, who put in a ton of hours into this and also are kind of our gatekeeper for the budget throughout the year. So we thank all of them for their help with it. Just first off, to give you just an overview of our department, we currently have 230 total sworn officers. That includes the 9 new positions that we added through the COPS grant. We have 38 civilians, and last year we went on a little over 81,000 calls. This just gives you a breakdown of the total budget. About 85, a little over 85% of our operating budget is personnel costs. So, and then we have a very small portion that's in the capital fund, a little over $500,000. And as part of the capital program, it's basically made up of the strong majority of it is patrol vehicles, and we have 2 other items in there for 2011. One would be a gas chromatograph, which is basically a machine that's used by our chemists to, this particular one will be used to determine blood alcohol levels, because we do all the blood alcohol testing for DWI arrests within our county. And the other item is digital video storage, so all the vehicles that have cameras in them, just the storage of that, which takes up a fair amount of space. Each of those items are about $50,000. So this just gives you a breakdown of the budget by programs throughout our department, and as you can see, the largest portion of our budget is patrol at almost 58%. With detectives being second. So when we put together our 2011 budget, there were, whoops, I think I went by one here. This is a breakdown of our budget by program area and what the adjustment change is to each of those different areas. There's just a very slight increase in our overall budget from 2010 to 2011. Just a little under 1%, and that's basically due to step increases, rate increases, fuel, things like that we don't have a lot of control over. And then we also added the red light camera system to our budget, which is under the company name of Redflex, is how you would see it in the budget. That's about a $270,000 item, but you'll also see a revenue amount pretty much equal to that, so that's offsetting. So we know that we're currently in the middle of a lawsuit with that, so we'll see how that plays out and whether or not we continue on with the program. But for now, it's on hold, so it really won't have an effect on our budget either way. So. There were basically about 4 different areas where we had an impact on our budget when we were looking for ways where we could make our budget work within the revenue. And so the first one we'll talk about is overtime. Just to give you a little history, in 2009 we had budgeted about $900,000 in our budget for overtime. In actuality, we spent about $665,000 in overtime. Historically, we've had about $900,000 in our budget for overtime, and it's a difficult one to predict. We know there are some things that are going to be a given, like holiday pay, court pay, those sort of things, but I can't predict whether or not we're going to have a disaster or a big homicide investigation or things of that sort. But what we have done over the last few years is looked at the areas where we can control that, and basically through creative scheduling, we implemented different shift hours, which we actually did at the beginning of 2009 to create some overlapping shifts and make better use of our personnel. That virtually eliminated a lot of the higher back situations that we'd get into when people would call in sick. And then we also looked at scheduled events that we might have throughout the year. Several years ago was pretty much the practice. If you had a presentation or a special event you had to be to on a weekend or on an evening, you'd get paid overtime for that. Well, economic times just simply don't allow that anymore. So we actually started that several years ago and slowly working on eliminating that. And so if an officer works a special duty or an extra assignment and they know that's coming up, they can adjust their schedule throughout the week. If they're in a position that allows that, then we do that. And we've had some great success in helping to reduce our overtime. So as we go into 2011, we actually, for 2010, our budgeted amount that's at the holdback amount is $685,000. So it's really only about a $10,000 difference from 2010 to 2011. Training is another area that we reduced considerably for our 2011 budget. But if we look historically in 2009, we had about $167,000 budgeted for training, but we actually only spent about $87,000. But you might recall that was about when the economy was starting to take a downturn, and there were citywide looking for ways to save money, and that certainly was an area where we could, and we did. So we reduced in areas where we felt that we could. We have not reduced since then, and don't plan to in 2011, necessary training that our officers might need for certification processes or those necessary items that are mandated by state law. We still plan to do that. Although you will see that in 2011 we obviously have reduced our proposed budgeted amount virtually down to almost nothing compared to where it was a couple of years ago. We're down to $10,000, but we do have some grant money that we received over the last year through the stimulus grant package, and also we receive federal grant money every year for equipment needs and other needs that we have throughout our department. We've actually earmarked a large chunk of that to help pay for some of this training needs that we might need. So we're comfortable with that going into next year with what we have there now. It's a 4-year grant. Obviously, it looks like we'll probably have to use up most of that within a year, but I think if we can get through next year, we'll take 2012 when it gets here. So. The other area is staffing. We haven't reduced any police officer positions. We did actually were able to reduce 2 of our civilian staff in our records section, and we did that through a couple of different ways. First off, over the last few years, we are becoming more and more paperless, and so there isn't near as much data entry or areas where they need to actually touch the paperwork as much as they used to. And the other one that we're just about to launch, we've been in the build phase right now and hope to have it up and online here by this fall or definitely by the end of the year. It's called e-ticketing, and that is the system where you get stopped by an officer, they can take your driver's license, swipe that through a card reader. It will automatically check background or history, driver history, see if there are wants or warrants, and then also automatically enter all that information into the system. If the officer determines that he wants to write a citation, you can simply type in what that is. It'll know the fine amounts and so forth, and you can print that all out, and you can actually write several tickets on one page. The great thing about that is then currently when we handwrite a ticket, then a records clerk has to take that ticket, manually enter it into the system, and go through each of those individually. Now that'll all interface automatically and goes right into our system. So that's how we were able to eliminate those positions. I believe the COPS grant, when Bill O'Toole gave his presentation, came up a little bit, and there was some discussion about that, so I thought maybe I'd hit on that a little. We, as you know, a few years ago when we put together the staffing plan, our goal was to add one officer 24 hours a day, 7 days a week. To do that takes about 4.2 FTEs. So we had in our plan to add 4 1 year, 5 the next, 4, 5, and so on. So when we applied for this COPS grant, we actually built that into there for the 2010 amount that we would want, which was 4 officers, and 2011, 5. So that's why we put in for 9. We were fortunate to be awarded all 9 of those positions. That COPS grant funding does not kick in until you actually hire the officer, and it doesn't expire. It's a 3-year grant, but we're able to extend it until you actually use up the money, and it won't actually expire until September 30th, 2015. So we have a little over 5 years to use up that money, which is just slightly less than $2 million. So I'm pretty confident that we'll use that all up. But the thing to note about it is it does mean in 3 years from now we're going to have to pick up the full tab for all 9 of those positions, because we hired a few in a group about 6 months ago. Actually, there were a few that started today. So, and as officers maybe don't make probation or they quit or for whatever reason, if they were designated as a COPS officer, then we start that time clock over again and pick it up when we refill it. So it's not uncommon for these grants to go 4 or maybe 4.5 years before we fill them out. But so there won't be that big hit to the city when we get to the end of 3 years and we have to take on all 9 of them. So in addition to that, as part of that grant money that I talked about that we use for our training, we also received some funding that we use to help pay for all the equipment to go with those 9 officers. We purchased 2 squad cars, all the equipment that goes in those. So really, other than maybe a little bit of overtime that they might incur, there won't be an expense, especially this first year equipment-wise, and then personnel-wise until they've been here for at least 3 years. And then the other area where there were some reductions, which were basically citywide, were the contracted services. The biggest one being Metro Communications. As you might recall, they were the one entity that did not get a 15% holdback implemented in 2010. We are doing that into 2011, so it's they're seeing a reduction, and as you know, the city pays for 75% of the costs for Metro that the 911 fee doesn't cover. And then the other areas that fall under our department are listed there. Let's talk a little bit about some of our accomplishments in 2010, and obviously we're just a little over halfway through the year, so we hope to accomplish even more. But probably the biggest thing that you maybe that we don't have on here, that you just see day to day, or you read on the news, or read in the paper, or see on the news, is just our enforcement work. The crimes that we solve, the the issues that we're dealing with on a daily basis. So certainly not going to list all of those here, but just looking at statistically, when we compare ourselves to other cities of about 100,000 people, our clearance rate if we just look at violent crimes, for example, our clearance rate is around 63%, which doesn't sound real great, but when you compare us to other cities of similar size, they're about 50%. So we're significantly higher than that. And there's really a difference when you look at the same sort of stats with property crimes, where the national average is about 19%, and we're around 47%. So I think we've done a great job with that, and we're going to continue our efforts there. Just a couple other things to highlight that we've accomplished so far. We've going into the Facebook page. I'll admit that's the first time I've ever signed on to Facebook, so I'm now a member, and now the police department also has a page on there as well. So hopefully we can reach out to some of those younger folks that like to use that, and even some of the others as well. We're in the process of upgrading our video system within our detective division. That'll all be digital, so that'll make for easier access both within the department and for the court system. Did a little expansion with our freezer storage in the Gray Bar building. We got rid of we're in the process of getting rid of all the shotguns in our patrol vehicles and transitioning to rifles. We have, in the past, had a handful of officers that were certified with the rifle, and so they'd have to carry that in and out of the car, just those that were designated for that shift. Through some of that grant funding, we were able to purchase enough rifles so we can have one in every single car. It's a .223 caliber rifle. So to purchase those and the lights, we did that with the grant funding, and we've been also in the process of training all of our officers into use of those over the past year. And the last one that we're just beginning now, we're going to be training some folks to train our field training officers, is looking at, or we're going to go to a new field training program for our recruits, rather than being, our current one is more of a evaluation and training, and the new one's going to be more of a mentoring and coaching process, and we found that using that emphasis is a much better approach, especially with the different newer generations that we're dealing with. They're a lot more receptive, and in looking at other departments that have gone with that, they've had much better success rate in retention, and the officers catching on much quicker as they go through that process. A few of the things that we're looking at for 2011, we're going to, I'll outline those here in the next slides. First one is we're going to a team policing approach. It's called many different things throughout the country, and we're working on a version of our own here. Basically, it's going to involve our officers getting more involved in the community or the areas that they're assigned to, and more accountability as it pertains to their areas, rather than just having, say, for example, a shift commander is responsible for just a certain time of day. He's going to be responsible, or he or she is going to be responsible for an area of the city. When we have issues that come up within that area, they're going to be held accountable and come up with solutions and ways that we can work with that area to either try and prevent or try and solve some of the issues and concerns that we're seeing there. As part of doing that, we involve all of the different areas within the department, and we'll do bi-monthly meetings so that you can share that information. You go through one of these meetings, and you're going to know what's going on in every area of the city and what we're doing to help try and approach or try and solve those problems and find better ways to do it. Going to do that through effective use of our crime stats and just looking at better ways to help get that message out there and working with the community. And we've been using that approach in certain fashions throughout the last several years, but I think this is going to be even a better approach. We're going to hold people more accountable, and I think the citizens are going to be very receptive to it. So. Another one that, frankly, we've been working on for several years. You may have heard it for those that have been around before, but I'm happy to report that we finally have got to a point where we're going to be able to make it a reality. It's a program which CopLogic is the name of a company. It's a software company that we're looking at, but it will allow citizens to, for those minor report calls, do that report online if they choose to. Say, for example, if you lose your cell phone, some cell phone companies might require you to do a police report before they can replace that. Well, that requires an officer coming into your house, so by the time you factor in the travel time, writing the report, going through all that, they can tie up easily a half hour or better. In a call like that, they can go online. There'll be certain steps they can go through that will either allow them or not to do a report online that will interface, and we'll have a detective that will review it the following day, and it's going to save a ton of time. We do have some grant money that we've actually had earmarked for this for the last couple of years, so we're finally going to be able to utilize that. I don't like to be the test site, especially when it comes to new software, so we were waiting for another city within the country to get it up and running and working, and they're finally at that point, and they have the same record management system that we do, and so things are working out well, and so we're ready to roll with that soon. The other one we're looking at, we just transitioned this year in our crime lab from a sworn lieutenant to a civilian position. Very pleased and happy to bring on board a crime lab manager with considerable experience in that area. Actually comes from Colorado and worked in a lab that was accredited. And so our goal is to get our lab accredited. Certainly there's a process that goes with that. As you can see, there's several years, and there's some money that goes along with that. But probably the biggest reason that we want to do this is it lends credibility when it comes time for the courtroom. And when we're presenting and we have our crime lab folks in there talking about the process they went through and the evidence and procedures, we want evidence and testimony that's going to hold up in court, and certainly this will be a great way to get us there. And another great factor with that is once you are accredited, it opens up your opportunities to apply for different federal grants, like the gas chromatograph that I talked about earlier, $50,000 item. We can't apply for that now because we aren't accredited. So hopefully that'll free up some financial opportunities for us as well as we go into the future. And the last one that we are working to equip our motorcycle officers with some more technology, the computers, they don't currently have that, and also audio-video recording, some of those things that are in a patrol car but not on a motorcycle, and then like I talked about with the e-ticketing so that they can issue the citations, they'll also be able to do that. Again, that was a project that we had earmarked some grant funds for, so we hope to get that rolling soon. And in summary, although there are certainly some reductions within our budget, I'm very comfortable with where we're at, not only on the operating side but on the personnel side. The staffing, I know there were some concerns about the staffing plan and how that looks as we go into some of the out years, but keep in mind that we're just allocating funds for 2011. And where we're at with our staffing in 2011 is right where I wanted to be if you'd asked me 3 or 4 years ago. It's tough for me to predict further out than that. I have no idea if the city's going to continue to grow. I don't know if our crime is going to continue to grow. So those are, I think we're too far out to try and predict that. And like I said, we can't allocate funds for that anyway. So what we're dealing with for the 2011 budget, I'm very comfortable with that. So I think by sticking with our plan, we're going to be able to continue our commitment to this city to make it a safe and great place to live, and continue us on into the future with that same approach. So with that, I would take any questions you might have.
Questions? Councilor Erpenbach.
The one question that we heard, and I know that others on the council heard it as well, is there a cut in the uniform? Now, the word went out of me. The amount,
allowance?
Yeah, the uniform allowance. Has there been a cut in that so that it would actually reduce officers' pay?
No, there is not.
There is not a cut in uniform allowance. Thank you very much.
Councilor Rolfing.
Maybe you can help me understand on the program under the expenditures, the administration. There seems to be 9% increase in administration. Is there, can you explain why that increase is there?
Yes, what we did, we actually moved, well, first off, Red Flex, the red light camera system is in there, and then we also consolidated. We used to have the training split out amongst all the different programs. We put it all under one, and I believe fuel is also under there. So it was more of a consolidation of different things rather than an increase in that actual area. So by looking at the number, kind of gives the impression that we raised the administration where in fact we did not.
And then one more thing, the cutting of the training bothers me. How long can we hold that? You're not holding it off, you're using grant money, but then, every time we use grant money, it scares me because there's always an end to grant money. And all of a sudden, we got to come to the end, and then we got to bite the bullet somewhere along the line. And we can't afford not to train police officers and firefighters and people that, we put our confidence in that they're going to take care of us. So how long can we do that? How long can we count on that, and then can we get it back into the budget?
Well, I can't guarantee what level of grant funding lies in the future.
Exactly.
So this is based on what we have that's basically in the bank right now. And it certainly isn't going to be a level of funding that we had, say, 2 or 3 years ago. But I'm comfortable with the amount of money that we have on hand to do that. One of the other ways that we look at training to try and save money rather than send, say, 2 detectives out of state to a homicide investigation school that we might spend $2,500 to $3,000 on, we might look at bringing that instructor in here, and then we can teach 20 people rather than 2. So we're just trying to be a little more efficient in how we use those dollars. But on the other hand, there are certain specialty areas, like when we look at the crime lab, they're going to have, that'd be one person that's going to be specializing in fingerprint examinations. They're the only one that's going to go to that training, and they don't offer that around here. So, yeah, there are some dollars involved in that.
Yeah. But I think we as a council need to be aware that we keep putting these things off and using grant money. It's like the police officers in 2015, that money's gone. And now all of a sudden we're going to have to come up with that money to fund and pay the salaries, the pensions, all the money there along with the vehicles because they're going to be, that money's not going to be there anymore. So I just caution us to be aware of that.
Councilor Entenmann.
A couple things, Chief. First of all, on special events. I know your crew, the traffic crew, does a fantastic job on all the special events we have in the city. And there's been some questions. I know on some special events with the Parks Department, there's been cutback in staff in some different areas, and there's been a lot of discussion about that when the events come up. In some communities outside of our area or in our region, does the police force assess a special fee to help cover the expenses of your staff or your officers for those things? I know we don't do that now in the city of Sioux Falls, but is that something that does take place around the region or this country?
It certainly does, and it's a good point. It's been a topic of discussion numerous times over the past years, and frankly, it's a service that we'd like to provide. It's like a funeral escort. There are certain cities where they charge for that as well. For me personally, if we can afford to do it as a city, I'd rather provide the service. You're paying taxes. That's part of the package. And if we can continue to do that without charging that fee, fantastic. I think if we get to a point where we're really in dire straits financially, then perhaps it might be something that we need to look at.
Okay. Another question I have, too, as far as staff goes, the officers that you have. You explained the COPS program to us really well, but what about normal attrition of officers, retirements and things like that? Is it policy that you replace those officers that do retire then so we don't find ourselves short?
Absolutely. Matter of fact, as a requirement of the COPS grant, you can't supplant. And so it's been a challenge to even fill the vacancies that we have so then we can fill the COPS grant positions. So as we sit today, we just hired a group this morning. They just started today. We have a total of 3 vacancies. So 2 of those are COPS grant positions. One is from an officer that retired, and then we have another one that is going to retire in October. So we've been filling those positions through attrition, and frankly, we have to. We have a total of 12 positions in our department that are grant funded, And if we were to reduce some of our city-funded positions or just not fill them, we're going to get into trouble with the feds with our grant, because then you are supplanting. So basically, if you wanted to save city dollars, you'd have to first eliminate the 12 grant positions, then you could get into city-funded positions. So to save money, you'd have to lay off over a dozen to even get into that. So.
Good. Another question I have is concerning community service. I notice you've got a budget decrease of about 8% in community service in the line budget here. You're dropping about $200,000 out of that. And then we see that you had this proposal of being more involved in the community. Whereabouts are those, where is that decrease coming from?
Well, the Community Service Division is mainly comprised of the school resource officers. We also have a couple of crime prevention officers that fall under there, school safety, some of those things. So, frankly, we looked at, when we put our budget together, there were a lot of small reductions in a lot of areas. So certain things where we can maybe reduce a little here and there to help make up the difference, that's where we did it. So we aren't going to reduce the number of officers in the school. Okay. We're going to continue those efforts. We're still going to do crime prevention as we always have, and there just maybe a few different little items that go along with that we might have to get creative with, but I don't. The average citizen will not notice an impact. So.
Great. Another question I have is that you did bring our attention to the fact that Metro Communications did not get hit with a 15% holdback initially this year, but our plan is to reduce their funding by about 15%, and we see that in the budget here. It's down about 18%. And it's my understanding that one of the things that we're putting off in Metro is a new telephone system. Is that correct?
Yeah, and the interim director, Michelle Boyd, I believe, she's going to be here next Monday, I believe, to give her presentation. So I'll probably let her speak to a lot of that. But from what I understand of that, they don't have a capital program, so they have to create their own, and that is a system that needs to be replaced, not necessarily next year, but within the next couple of years. So they're in the process of building a pool of cash that they can then make that purchase with. Good. And I think they've also got some grant funds that are going to tie in with that as well.
I know Councilor Jameson and myself serve on that committee, and I think we did take a position at that we can understand, and they were right straightforward, and they admitted that we're doing a great job, but we think that we've stretched our resources about to the max here. But then I believe I made the comment at that point in time, there's no way that I feel that we're going to compromise the health, safety, and welfare of our community. Our 911 services that we provide and the expertise and the professionalism there, I think, is extremely important to this community. And as we go forward in the future, if the funding isn't there, we're going to make sure that we get that funded. I think that's very much a priority as far as I'm concerned. Okay, thank you, Chief.
Thank you.
Councilor Aguilar.
I just have a couple questions. I want to go back to the training. You said that in addition to the $10,000 that you're going to be using grant funds for 2011. Can you give me an approximate amount from that grant?
About $100,000.
And how much is that grant for?
Well, that funding came from a stimulus grant funding, which was about a little over $500,000. But we purchased 2 squad cars, equipment. There was a couple other items that came out of there. So we had earmarked about $100,000 of that for training. Now,
over a 4-year period?
It's a 4-year grant. We can use it all in 1 year, and we don't have specific. Sometimes it's difficult to project what you think that training need is going to be. Opportunities come up, different schools or officers might transfer around. Maybe we have a new detective who needs to get some interview skills or, those sort of things. So it's tough to plan that out. So that grant's really flexible in how we use it, and we can reprogram it for different needs. And as far as that goes, if there was some equipment need that was unbudgeted that came up that we thought was maybe more important than using some of those training dollars, we certainly would have that option too.
Okay, my second question has to do with contracted services. Metro Communications, you said, did not get the holdback this year, so that's going to be the holdback this year. Well, the others that are listed did have the holdback in 2010. Is that correct?
Correct.
will there be further, other than the 15%, will any of those be hit any harder in 2011?
I don't believe it was much of a change, if any. Matter of fact, I think there might be one that actually went up a little bit, but they're all pretty close to flat to that 85% level from 2010.
Okay, thank you.
Councilor Brown.
Chief, I do want to spend a little bit of time on staffing levels. First of all, from 2000 to 11, I see your authorized positions are down by one. Is that a uniformed officer, or what position are you down by one for 2011?
That was the police lieutenant that we converted to a crime lab manager. We used to have a police lieutenant that managed our crime lab, so now it's a civilian position, so we just swapped that. That didn't affect officers on the street.
And then I want to talk about the 5-year staffing plan. Just as we do a capital improvement plan, even though the money's only allocated for the next year, I think it's important that we plan long-term for where we're at. Because if Mike Cooper were in the room today, I don't think he'd tell us that we're planning for a smaller city. And if projections are correct, even conservatively, we'll add 10,000 people to the City of Sioux Falls without adding any officers. I don't think that's acceptable.
Again, it's a plan, and that plan was put together. We're one piece of a 12-piece team, so we have to look at all the other city needs and what is the financial situation. We have to project what we think the revenues are going to be, and so as part of that, this is basically how was the best option and the way that would work.
Except we don't project the revenues out beyond 2011.
What's that?
We don't project the revenues out for 2012, 13, 14, 15. So how are we basing those projections on staffing being reduced so dramatically when it's not a revenue equation?
There are some revenue projections that are built in and looking at what's in reserves and some of those things, which finance obviously could speak to better than I can. But ideally, the economy will turn around and we'll be able to get that staffing plan back to where it was a couple of years ago, not only in our department but several others.
Last year, you were more than half of all the new positions in the 5-year staffing plan. What is the percentage this year in this staffing plan with just 2 positions being added?
For 2011?
The whole 5-year plan. Last year, you made up more than half of the new positions in the 5-year plan. I'm curious what that percentage is this year in the next 5-year plan.
I'm not certain what that is. I do know that when the plan was put together, the approach was to put an emphasis on public safety, which includes police and fire. And I know there's a projected fire station opening within that 5-year plan, so they obviously need a large portion of the resources to staff that. So I know that was built into there.
I think it's important because I have also received the emails, and I think the public needs to understand what kind of impact they can expect, because all of these areas are down in expenditures: investigations, crime lab, community service, records, animal control. We've talked about metro communications. What service level expectations should the public expect with those reductions?
Our plan and our hope is, unless something unpredictable happens, that we'll be able to continue that same level of service that people have come to know and expect. And there may be some impacts internally that we need to do to adjust and make it work, but I'm comfortable with the way the budget's set up to get us through 2011.
What is the 66% cut in sick leave and benefits? Page 27.
That if an employee is hired before 1983, they fall under a different contract where they get paid for a portion of their sick leave annually. It's an old clause that's been on the books for years, and after this retirement in October, we'll only have one of those employees going into 2011, so that's why that was reduced.
The job performance reduction, I assume that is the training that you were talking about?
Correct.
Repair and maintenance down more than 42%. What areas are impacted by that? I'm sorry, it's 16% on repair and maintenance.
Again, nothing significant. I mean, we're going to continue to repair police vehicles and things of that nature, that those necessary items. There may be a few things that if we were able to put off for a little while, we're going to do that. But again, that should not affect our level of service.
And rentals down 42%. What do we rent in the police department?
I believe there was the animal control contract for Second Chance, or actually it's with the Humane Society. For whatever reason, used to be in that category. It actually should be in professional services. So now it's being moved up to there. So that made that difference.
Thank you.
Councilor Entenmann.
Could you explain a little bit about, when you look at what your staffing needs are? I know they're budget-driven in a way, to a point. And then we talk about public safety needs, Councilor Brown brought up. But can you tell us how you, other than budget needs and stuff like that, can you tell us a little bit about what you consider when you look at your staffing, when you need an uptick, when you think you need to have an increase in officers or those kinds of things? And I do understand that this is for this first year, that no matter what your staffing plan is going out for 5 years, I'm assuming that if you determine there's a need for those officers, that you're going to plug them into that budget, correct?
I certainly will put in for what needs that we have, and obviously that's within whatever means are available. So,
can you explain a little bit about how you analyze what your department needs are,
Sure.
what factors you account for?
I wish there was an exact science where we could just plug a formula in and we'd know exactly how many to go by. And when we compare ourselves to other cities, there's so many other factors that go into that. You have to look at where you're located geographically. Are there other large cities close by that you're maybe drawing in, different crimes that way? We look at what's our response time? How long is it taking us to get to the calls? Are we holding a lot of calls? Frankly, are we getting a lot of complaints? Are people calling up and, geez, it took me, 20 minutes before an officer showed up? That's unacceptable. And a lot of that is, what will the public tolerate? I mean, are you okay if you have a car accident and you're sitting in the middle of the intersection? Are you okay to stand there for 10 minutes or 15 or 20? What's that threshold? And so it's not an exact science, but I think you might agree if you just look at how our department's operating, that the way we've been doing it is working well. I've got a very good feel for where we're at staffing-wise, and I think, I look at the number of calls that were going on, different types of crime, problem areas within the city, if we're able to address those. And frankly, you could tell me today that here's funding for 20 new officers, and I'll give you the money today. Because of the hiring process and the training process and getting them through the academy and peer and finding slots, just like the 9 officers, we received that award just a little over a year ago, and now here we are today just starting to finalize some of those positions, which is fine, but it's just so you know that whole process, you're basically planning out at least a year or two, so the officers that started today, we probably won't realize the benefit from them well into 2011. So it's an ongoing process, and the way we've been doing it has been working well, and I think we've been staying ahead of the game. I don't know if you know, but within the last 3 or 4 years, we actually had a couple of years in there where we only hired 1 officer 2 years in a row, and that was a grant-funded position. The city didn't fall apart. We certainly were able to keep up. And we can do that occasionally and maintain. And so I don't think we're ready to throw up the alarm flag just because the plan shows a couple of zeros in some outlying years, because a year from now things can change completely.
Thanks, Chief.
Any other questions for the chief?
Yeah, one more.
Councilor?
I don't want to keep beating, if the horse is already dead, I apologize, but did you ask for more officers for 2011 than what you were granted in this proposal?
No.
Did you ask for more officers in any of the future 5 years than what is in the plan that we're seeing now?
If you go back a couple of years, as I touched on earlier, our goal was to add one officer 24 hours a day, which would be the 4-5-4-5. Who knew the economic times were going to change completely, and that's when the plan changed along with that. So in order to accommodate that, for me to say that that's no longer our goal is not true. But again, there are probably a lot of things that I'd like to see in this budget that I can't because, frankly, the money isn't there. So living within the means and the projections the way they are, and again, I'm not a one-person department here. We're part of the whole team within the city, and we rely on other departments for support needs, and so all of that factors into it. And so given all of those things, I'm comfortable with where we're at.
Okay, thank you.
Okay, I think we're done.
All right,
Chief,
thank you.
Thank you.
Thanks.
Next, we'll move to fire.
Next.
Don Hill, welcome.
Good afternoon. Yeah, we got it right. Okay. Don Hill, Fire. Our department overview, we have 194 authorized positions, and of that 194, 186 of them are firefighters or inspectors. We have, you have our list of facilities there. We have 10 fire stations. Our training center is on the airport grounds. Maintenance shop and fire headquarters are associated with fire stations. We have 11 first response at fire apparatus, and in last year we had 9,206 calls. Some of our accomplishments for 2009 and 2010, we've talked before about fire statistics, and we have better fire statistics in Sioux Falls than other cities our size, and I just want to give three of them. We had 308 fires last year. A city our size normally has about 600. We had one fire death last year, and the national average for a city our size is 1.2, and that's also our 5-year average is 1. And then last year we had $4,165,000 in fire loss, which sounds like a lot, but that's about 2/3 of the national average for a city our size. And our 5-year average has been roughly 2/3 of what the national statistics are. So we maintain good fire statistics. The next 2 or 3 things here I have are internal things that you may not see a direct service change to the public initially, but they're important for the department, and one is that we've reached agreement with Local 814 on physical performance standards for firefighters. So beginning next year, all of our firefighters will have to pass physical performance standards. And again, that was done as a joint effort between the union and the city. Secondly, we initiated a succession plan, worked with Bill O'Toole in HR on this. In the next 15 months, half of our management staff is eligible for retirement, including 4 out of the 5 highest ranking officers in the next 15 months. So that is an important part of what we're doing, training up the next level of officers to fill those roles. And then also then things that do directly impact service are that we opened Station 5 last year, and that station is on pace to have about 1,100 calls per year, and that was our, in the middle of town, that was our longest response time area, so that 1,100 calls will improve the service to the east central part of the city. We have a remodel of Station 2, which is on Sycamore, just north of 10th Street, in progress right now. And then this year, we replaced 2 trucks that were 34 years old, and those are some direct impact services there. Our total operating budget is $20.9 million. You've heard numbers And what percentages are? They are personnel costs. Ours are over 90% of our operating budget is personnel costs. So it's a highly labor-intensive department. Our request for next year is up 4.3%, and our personnel costs would be up 4.4%. So other than our personnel cost increase, the rest of the budget is a reduction. The reason for the 4.4% personnel increase, there are two main reasons. First is that we're in the third year of a labor agreement with a 3% increase for the union members, and so that's part of it. And then also the benefit level, specifically the pension contribution is up significantly because when the economy goes down, the city's portion of the pension contribution goes up. So those are the two main reasons that our operating budget is up. Our capital program for next year is $1.4 million. We have a rebuild of Station 1 apparatus floor, which we talked about in the capital discussion, and also one fire truck. Between those two, they're about $1.2 million. So of the 1.4, a fire truck and the rebuild of Central Fire Station's floor. Operating budget and personnel impacts on the budget. We have made an adjustment to our staff, a new staffing plan essentially that has reduced our overtime significantly in the last 3 months, and that's the reason for the lowering of our request for next year in overtime. We also will modify in 2012 our hiring practices and also our benefit scheduling that will further improve our staffing without adding full-time employees. Another thing that we've done is on most medical calls now we respond with smaller vehicles rather than fire trucks, which will save wear and tear on the trucks and also save a small amount of fuel, but we'll need to study that to see how much of effect that will have on our large fire trucks, but we're expecting an increased lifespan on those trucks. Also, repair and maintenance. We are repairing and maintaining our stations and facilities on schedule. We have made some minor adjustments to do things more efficiently. For instance, we used to have laundry service at our stations. We no longer do that. We're having our firefighters do that at their facilities. Some of our outcomes, we do CPR education, and our goal for this year, or for 2009, we did not meet our goal because we had our primary instructor was out for an extended period of time with a medical condition. Also, we had, so our goal in the future is to educate 2,000 people this year and next year in CPR. And we do fire education to all the elementary schools in Sioux Falls. We'll continue to meet that. One of the big things that we are working on is our insurance service offices rating. We have been a Class 3 city for a long time, and our goal for 2011 is to reach Class 2, which has a potential savings of $3 to $5 million for businesses and homeowners in Sioux Falls if we attain that rating. Again, each individual insurance company handles things differently, but that's the potential savings. And then our accreditation, we have maintained that and expect to continue to do that. Our building surveys, our goal will be 7,500 for this year, 7,500 business inspections. And then we're required to maintain accreditation. One of the many things that we have to meet is a response time of 5 minutes and 12 seconds or less 90% of the time. And last year we responded to 90% of our calls in 4 minutes and 59 seconds. So, just a quick overview for you, and I'd be glad to take any questions.
Councilor Anderson.
Chief Hill, with the delay of the 41st Street and Highway 11 fire station, are we going to be able to keep our response times in that area?
Yes. I actually, as we were balancing CIP, I actually offered that we should move that station out because we have seen a slower pace of development in that area, and we had no calls in that area last year. So where we projected that by this time, by 2011, that we would start to having some calls, and then in 12 have the station open, that hasn't materialized, and so I'm comfortable with moving that out a couple of years.
Also, with the emergency calls, being the first responders, using smaller vehicles, I take it that you're going to send 2 officers in that smaller vehicle. Would I be correct in that?
No, we actually send 4.
4?
We send the full fire crew because a 2-person fire crew is useless. So if you leave 2 people at the station, they are not able to do anything when he gets to a fire call. So we actually respond all 4, and normally on a life-threatening emergency medical call, we use at least 3 people to treat the patient.
Then to continue on that, at each fire station, how many EMTs, trained EMTs, do we have at each fire station to respond to these calls?
All of our firefighters are EMTs.
Thank you.
Emergency medical service is last year was 50% of our or 57% of our calls.
Councilor Brown.
Chief, what is the professional standards expenditure that was reduced by about 45% on page 18?
The professional standards, we reallocated, similar to what I think it was police had done, between divisions, so that we moved more things into administration and out of other divisions just because of who handles the budget for those.
Okay. And then explain to me again on the overtime. I understand the staffing levels, night versus day, but explain to me when someone calls in sick, how you told me in person, but I can't remember exactly how that works, because sometimes you can't get up to full staff even at that reduced level.
What we have done, and I've looked at staffing for a lot of years, and we've done a pilot program on increasing daytime staffing as the city grows, because as we get to be larger and larger, statistics just become more and more solid that two-thirds of our calls roughly are daytime, 62% actually are daytime, and 38% are night. And fire departments traditionally run the same level of staffing daytime and nighttime, regardless of where the call breakdown is. And it has been consistent for many years now that we have more calls in the day than at night. And also, that's the time when we do everything else. We train, we do our building inspections, we do all those things during the daytime. So we just did not have the right system, right setup in place to be able to change that setup easily, because firefighters traditionally work 24-hour shifts, and all of their shifts are 24-hour shifts. We now have once every 27 days, each firefighter has to work a 12-hour shift. And so what we've done basically is move more of those 12-hour shifts to daytime and less at night. So we're able to staff more people during the daytime than at night, and still keep all of our stations staffed. What we do is we start out the day with a certain number of people, daytime staffing, nighttime staffing, and it's different. And if people get sick, or we have other kinds of leave that we did not anticipate when we scheduled vacations at the beginning of the year, then we will reduce that staffing, particularly in the evening, to the point where we actually run with one less truck in service at night. But we have 11 trucks normally, 10 stations, so we're still able to keep every station open and take advantage of that time when we have 38% of our calls by closing down one of the trucks. And that's how we save the overtime, is by not backfilling when we have some sick leave, by increasing daytime and then reducing night and then not backfilling when we do that.
And then we are on how many firefighters on a truck?
We run 4 on a truck.
And you can guarantee that we'll always have 4 on a truck?
Well, I can't guarantee what the funding will be on the department, but I have been committed to 4-person engine companies in the fire service for a long time because a 4-person crew is much more effective than a 3-person crew. And a number of cities run with less than that. They will run with 3, but usually when they do, they will have multiple stations that have 2 crews at them. We don't do that. In order to get the best service possible, we committed to spreading out our crews, getting a fully functional 4-person crew in as many locations as possible. And so that's why we would maintain 4-person crews. For instance, the city of Des Moines, much larger city, has 12 fire stations. We have 10. They have a lot more firefighters than we do, but they just put more people at the station itself. So that's how we committed to staffing quite a while ago. It's better service because it takes a certain number of people to be able to do the job. And by spreading them out farther, we're able to get our response times better. And response times in the fire service means better service.
Thank you.
Councilor Rolfing.
Thank you. Oh, yeah. Thank you, Councilor Jameson. Don, I see there's a large increase in your sick leave and benefits. Can you explain what that is?
Yeah, the sick leave and benefits, there are 2 elements of that. Chief Barthel talked about those. One of them is that senior people have an annual payout for sick leave if they don't use very much sick leave. And then at retirement, there's also a sick leave payout for people. So it's directly affected by the number of people that you anticipate will retire and what their payout will be. So that's what the sick leave.
So you kind of have the opposite of what.
Yeah, we must have
a
the
lot of them
opposite
ready to
situation because we figured out the number of people that retire with that benefit and have a plan for that.
Okay.
Any other questions for Chief Hill? Okay, Chief, I think you're done. Thank you. Any other comments or questions about today's meeting? Yes, Mr. Litz.
It's not about the budget here, but obviously I missed the first part, and as we left it a week ago, that we were going to discuss the RV boat ordinance, and I understand that has been postponed here today, and I'm just asking for myself and the public that might be listening, do we have a new date decided that when the full council will take that issue on?
We don't have a date. There's just been a little urging to maybe wait till after the budget hearings, but certainly we've tossed around a couple of ideas of how that ordinance could be revised, and one approach could be to make a recommendation and bring it on, put it on the agenda, and we could address it that way in the heat of the battle, or we could wait until we all feel more comfortable about maybe talking about it and have more time on our hands. But I'm willing to do whatever the body wants.
Well, I guess maybe Michelle and I felt that night, and Rex, of course, was out of town, I believe, but we felt that some of these issues get bigger than the committee, and we wanted to bring it back to the full council, of course, to get a little bit more input. Michelle, did you have anything to add?
Yeah, if I might, what I said earlier before you got here, Councilor Litz, was that we hadn't really scheduled it, and if I misspoke, I apologize. If we were to discuss it as a body now, that's certainly up to the group, but again, it seems like something that we really should schedule and have on our agenda, which it's not currently for today.
I think I would agree with that, Mr. Chair, so maybe I could work with Deborah or Jamie or whoever's, at the phone that day, and we'll schedule something when the timing looks a little bit more appropriate.
Right, then we could give a little more public notice, and so we could all be together on a planned sequence of events to review it, come with a proposal and bring it to the council.
Very good, then I'll work with staff then. Thank you, Mr. Chair.
Anything else? I was going to make a comment that's, I don't know if I should even say anything because I always get in trouble. But thinking and listening to the public safety presentations today, I was kind of just, thinking what exactly should we be getting for the money? Whether the budget this year comes in at 100 and, the sales tax revenues comes in at 130 million, what would we do with public safety? Would we allow more police officers to be hired? Would we go ahead and build that fire station? What would we do to make it better? And conversely, if it comes in at 110 million, we got to find $8 million to cut, what would we do to public safety? Would we do anything? It's almost like we got to find our fundamental tolerance for what it should be, and whether the economy improves or not, we have to fund that public safety at a certain level that we think is appropriate. If other departments have to suffer, then that may be the bottom line. But I was just wondering that thought, listening to their presentations, thinking, frankly, what does the economy have to do with it? Either we think it's important enough to fund more and over than parks, more than streets, or we don't. I'm just kind of trying to come to grips with that whole understanding now a couple of years into this job. It seems like it's got to come back to response times, just whether those times are acceptable or not. And if we know it takes $28 million for the police department to operate efficiently, that's what they get. The population of the city growing, I don't know if that's a factor, if it should be, but the response time sure would have a key factor in my mind about whether or not that dollar amount should go up, and whether the chiefs could assure us that adding more dollars would decrease those times or maintain those times. But I'm just struggling with this whole concept of understanding the economy and its effect on what we think is important and or what we think is the appropriate funding for public safety. Councilor Intiman.
Councilor Jameson, I guess I kind of agree with you. I think right now, being new to the process the way I have, the questions that have come up and seeing the interaction that we have between the department heads, led by the mayor, of course, but the interaction with the department heads, recognizing that there are efficiencies that they can find within their own departments, which I think has been key in looking at this budget process. I think the questions that we as councilors have asked these department heads, I think are very probing questions in my viewpoint, and I think it's good information for the public that we have out there as we seek to get that information for ourselves. With that in mind, I guess I do agree with you to a point. What does the budget have to do with it? However, we do need to be good stewards of the budget. But on the other hand, the questions that we have is, I think all of us feel that we're not ready to compromise the health, welfare, and safety of our citizens. And I think whatever it takes to ensure that we're going to have that, I think all of us are going to put that foot forward and make those kinds of commitments. So I think with the process that we've seen so far this year, I feel very comfortable. We've asked a lot of questions. I think there's going to be a lot more questions that are going to come up as we go forward. And we do depend on the professionals out there to give us some insight as far as what you need for your departments. And I think a prime example of what happened was the emergency that we had last week. To sit back there and see that in the Emergency Operations Center, the 30 or 40 folks that we had there, and then Councilor Jameson, you and myself and Councilor Rolfing, being out and seeing the intensity that the frontline people had, that the workers had out there, was to me totally revealing. When we see in our community that what you don't see is out of sight, out of mind concept. People really weren't aware. If it doesn't affect them, it doesn't affect them, and they don't think there's much to it. But I think the response that we had from the majority of our citizens and seeing what our folks did out there, to me, was telling that we have an excellent community here. We're very dependent upon each other to recognize what those needs are. and we get the job done when it has to be that way. I feel comfortable with the process that we have this year, but to your point, those are questions that I believe that we need to continually ask ourselves as counselors. Are we serving the best interest of our citizens? And right now, I think that we've asked those questions. I think we've got the best answers possible, and I feel very pleased with the process that we have in front of us.
Councilor Olfing.
I would agree with what Councilor Enneman and what you said also, Councilor Jameson. The one thing is I'll go back is this grant thing that bothers me. And I'm wondering if Chief Barthel, if you could give me an idea what your real budget is with the grant money put in there. You're showing here this year or next year. I'm sorry. Let's say this year, 27,027,800 with the holdbacks. Have you got a round figure of what it is with the grant money, and what it would be next year with the grant money?
Are you referring to the training portion of it? or-
All of it, all your grant money, the COPS money, the training money, any other grants that you would have. If that money fell apart, what we would need to come up with to keep you on an even keel with where you are right now. Or would you like to go back and take a look at that and come back next week and tell us?
Well, I'm processing the number, because a portion of it we're using already this year. And since those grant funds are usually good for 4 years, like the online reporting that I talked about,
Yeah.
those were grant funds we received a couple of years ago, and we've had them on hold, and now we're going to use those. Hopefully, the end of this year might be the beginning of next year.
Well, here comes the expert.
This is in there for the revenue grant.
Okay.
This
Well-
dollar figure.
Well, if you're just talking about the personnel side of it, the COPS grant is $652,000 for next year.
Okay.
And we've got a drug grant, 2 drug grant positions, $165,000.
625, one what?
The total is going to be $907,000.
Another $1 million
That's just
bucks.
for grant funding for personnel costs.
That's just personnel. What about that? Is that the training too?
No, the training is, we've set aside about $100,000 for next year.
Another 100?
Yes.
And what about the equipment? That equipment that the COPS deal did would be spread over, how long does the average car last?
About 3 years.
About 3 years, so we got to
And they're
do
about, with all the equipment in them, about $40,000 apiece.
about 40,000 apiece, so that's another $15,000 for how many cars? For all those guys, so.
There's 2, we bought 2 new cars.
So 30,000, another $30,000 a year, So we're up to $1,130,000.
I think that's right.
So I'm just saying, all of a sudden, we got another $1,130,000 that we got to add to the budget. By the time we got done with everything, I bet we could come up with $2 million pretty easy.
Certainly, there's a large portion of it
Okay.
that's funded through
I'm
grants,
just
yes.
making a point here that we probably need to look at that kind of a situation too. Okay, thank you.
Councilor Erpenbach.
I don't like to work from a position of fear. I'd much rather work from a position of we're moving forward in a positive manner.
Right.
So a couple of things. As a candidate for this seat, Councilor Aguilar and I spent some time with the chief, and he told us some stories about some of the undercover work that we're doing and those kinds of things that are preventing crime. He can tell you stories that'll curl your hair. But what I want to understand is, what I want you to understand and what I want people to understand is that the other day, last Monday, when we had a young woman speak to us about concerns in her neighborhood park, the first reaction from the mayor and from the administration was, what are the police going to do about it? And a couple of us, and we'll talk about it in the 7 o'clock meeting, but a couple of us from the council met with police officers on Friday, and they came up with a 10-point plan. It's amazing, the things that came out of that department, and I appreciate your work, Patty and Skip. Both of you were just so proactive. We have to understand that it is about the budget and it is about the recession, because I think we need to be ready. And if we know our history, study our history, What was the reason for Bonnie and Clyde? What was the economy like when Bonnie and Clyde were running rampant? And I know that's an extreme example, but when the economy goes south, so do our crime rates, would be my guess. So I think we have to be really careful about what we're doing with this budget. I think we have to be really careful about what we're willing to cut in times of need.
Councilor Brown.
I think you hit the nail on the head. It's hard to measure the crime that didn't happen. The prevention element is what's missing in these numbers. And on top of that, we always like to compare ourselves in crime rates, how well we compare to other cities. But when it comes to comparing number of officers per thousand, suddenly we run from those figures always. We don't like to talk about those numbers. Oh, they're hard to show the difference. You can't compare that. You can't compare us to other cities. But yet, when it comes to crime rates, we're more than anxious to compare there. You can't have it both ways.
Mr. Chair.
Councilor Litz.
Thank you, Mr. Chair. Vernon and I can't remember if Greg was here and Kenny, but when there was an ordinance on the books, and maybe it was a resolution about, the ratios, and when I was here, that was supposed to be in effect. It was never really carried forward, and I think Vernon and I were among the minority that voted to support that. And, a ratio is a ratio, but until I heard something better, I was not willing to let them go. That said, I think Chief will probably back me up on this, and that, the fear is that when the economic times get tough, that crime goes up. But, that's not necessarily supported by the numbers in a lot of cases. And I think things that do make crime waves go up and down, drugs, various other things, it's kind of a mystery. I don't know, Chief. I've kind of studied this somewhat, and the relationship between the economy and crime and drugs and crime and things like this here. If somebody could figure it out, I think they'd be very wealthy, because I've like I say, I've studied it some and saw no correlation or predictable pattern to that is discernible. Yeah, I agree. This is about our budget to some degree, and maybe we can roll this back. But I think that as councilors, it's our responsibility to keep a close eye on it. And I also appreciate Donnie and Chief Barthel's position, because not only do they have to deal with the rank and file, but the administration that's here, and then pressures from us. So got to read between the lines, I guess, of what these gentlemen are telling us when it's there, and then trust our guts on this and make our own minds up.
Okay, anything else? All right, we'll move this meeting to adjourn.